ng iba, siguro ano, lagay
Conference
mo
na lang.
for now,
Admin,
yes, admin conference.
admin conference na lang.
Yes, ma'am. Thank you.
Ano nga ba yun?
Rename din, sa rename yan, ma'am.
Ito yan. Yan na.
Okay. Sige, ma'am.
Baka magtaka sila, ang dami ko.
Ay, CR muna ako.
Hindi ako makita. Kasi yung ano eh, yung ang gaspang naman ng ano. Ayos.
Malinaw ba ako dyan, Ma'am Christy?
Dito sa cellphone.
Okay. Thank you. How about my audio?
Ito kaya i-ano ko.
Clear, Ma'am Christy?
Kaya i-ano ko.
Mas maganda ba close Mas maganda ba close ang aking polo? Recording na, ma'am? Buti wala tayong masyadong We are, recording na pala tayo, recording. Ayan. Pwede naman yan kapag i-upload natin, i-kakat natin yan. So, may ilang minuto pa, mag-CR na ako. gagamit ako. Ma'am Shell?
Okay.
Okay sa'yo?
Oo.
Okay, good.
Hindi siya nagpi-feedback.
Pero ma'am, kailangan naririnig kita eh.
Ay, sa phone ko siya.
Hindi. Paano ba to? I see. That's your
Sa phone ko.
Oo. Paano ko naman na maririnig yung yung nangyayari?
Dito. Ito sa laptop.
Ito ang naka-on.
Oo.
Pa-on nga
Ito
ako.
ang... Ay, hindi mo ito naririnig sir?
Hindi.
Ganun ba?
O baka dahil hindi naka-ano sa akin yung
Wait lang. Yung Bluetooth ko ata. Nag-double connect yung Bluetooth ko. Ako lang yung Bluetooth. Sige daw, sir.
Mic test? Mic. Naka-off ako ng niyan, mama. Mic test? Sige nga, isa pa. Mic test? Mic.
Ano ko?
Mag-ano ako? Para marinig ko.
Sige, sige.
Kasi ma'am, dapat malakas ka, di ba? Dahil dyan yung... Para lang marinig ko, ma'am. Mike? Sige nga. Ma'am, magpatugtog ka nga nung any video.
Lalabanan ng bakuna ang sakit. Inagay ang virus o bacteria na nagdudulot ng sakit at namumugyan.
Lipat ako din.
Parang ako ang mas madali maglipat.
Sige, sir.
Kaso kala ko magpaalam ka lang. Sige ma'am, wag mo munang tanggapin. Hello, ma'am? Ma'am?
Yes, sir.
Ana, kumusta?
Hindi na nagpipigta.
Hindi na, no? Pero,
Close ko na, sir.
pero magpaalam muna tayo kay ma'am. Okay lang daw?
Okay lang, sir.
Kunin ko yung mga props ko. Okay naman. Hindi na kailangan.
Close ko na, sir.
Oo. Sige. Okay lang mo.
Mag-et ba?
Oo, sobrang lamig siguro. So,
Ako Nation. Paano nagkakaiba ang mga bakuna? Nagkakaiba ang mga bakuna kung saan ito gawa at kung paano ito nabuhyat ng immune response para gumawa ng antibodies. Itong antibodies ay panlaban sa microorganismo na kalaunan ay magiging proteksyon laban sa totoong infeksyon. Ang bakuna ay maaaring pinahina o patay na organismo o isang genetic product tulad ng mRNA na gagawa ng protina ng isang virus o bacteria nang hindi nagdudulot ng Tara, sa Bida Vaccination. Ano ang maaaring antabayan ng side effects matapos magpabakuna? Maaaring makaramdam ng pananakit, pamumula, pangangati, o pamamaga sa parteng minakunahan na maaaring magtagal ng ilang oras. Lagnat, na ng katawan, pananakit ng ulo, pagkahilo, pagtatae, o pagkuluway. Agad na sumangguni sa isang healthcare professional kung makaranas ng anuman dito. Sa Bida Vaccination. Kailangan bang magpabakuna ang lahat? Hindi sapilitan ng pagbabakuna, ngunit hinihikayat ng gobyerno na magpabakuna ang publiko para maprotektahan mula sa sakit na maaaring Tara, sa Bida Vaccination.
Hi guys,
Super Ale!
today we're here together to support Laura and her family. We prepared a song called Better Day. So we hope for better days for all. Oh, it's gonna be it's gonna be alright. Remember the times. Running around full of hope and lost flesh. Young girl, you can't we have the hope of an outbeat. It all changes. The dumps are down. I look around and I see scared faces. She woke up to a bad a world full of uncertainty. But fear of the sea. It's all just something. I know that it feels like the world is falling down and we can't make it through. It's gonna be better days, better days, better days. Gotta hold on. Yeah, I know that it hurts, but the sun will shine through. It's gonna be better days, better days, better days. Around the corner, it's true. I know it's gonna be. You're guiding light. There's a new world with a new problems all the time. I got you, gotta look at you. Your affection, the feel you. You love you at all. Life was radio fighter, brand new you. And something it is from the ashes. The mirror I see. And all the words that of the summer you're crying, baby, let me dry your tears. I know that it feels like our world is falling down and you can't make it through. It's gonna be better days, better days, better days. Better days, better days, better days. Gotta hold on. Yeah, I know that it hurts, but the sun will shine through. It's gonna be better days, better days, better days. Around the corner, it's true. I said I know there's gonna be better days for you. I said I know there's gonna be better days. know that it feels like someone is falling down and you can't make it through. It's gonna be better days, better days, better days. Yeah. Someone is falling down. Better days, better days, better days. Just gotta hold on. When the sky's falling, windows being shorter, no matter the cost. Háblame, aquí estaré, te prometo que escucharé. Speak your mind, you know me, you know me. Move together, come together. You can dance beneath my umbrella. We'll be there for each other, step in step with one another. Move together, come together. Hand in hand, we'll break the weather. Though the clouds are getting redder, we're gonna move the world for the better. نصيحة قريب لا تحسي بالوحدة اتصلي فيه. You know you can call on me, always call on me. So whether the rain or shine, you know I'll be your side. Move together, come together. You can dance beneath my umbrella. We'll be there for each other, step in step with one another. Move together, come together. Hand in hand, we'll break the weather. Though the clouds are getting wetter. Let me see you move.
Do you know what trans fat is? Trans fat is found in meat and dairy products of ruminant animals like cows, goats, or sheep, or formed by the partial hydrogenation of oil to achieve a semi-solid form at room temperature. Trans fat is also produced from crude oil at high temperatures and the constant heat of oil. Trans fat is used to extend the shelf life of food. This is why it's found in almost every chocolate butters and shortenings, which are added to bread and other baked goods. Fried, fried chicken, donuts, and some Filipinos street food. It is also found in other common food products like 3-in-1 coffee, milk tea, pancake mix, and ready-to-eat meals. Trans fat extends the shelf life of food. However, it makes our own lives shorter. It raises your body's bad cholesterol and lowers its good cholesterol. This may cause clogged arteries, leading to heart attack and other cardiovascular diseases. Trans fat causes a lot of harmful effects to our health, but we can surely do a lot of good to stop it. Let's make the Philippines trans fat free. For more information, visit our website or look for Trans Fat Free Philippines on Facebook, Instagram, and Twitter.
Did you know that the Philippines has no law on the regulation of trans fat? According to the World Health Organization, around 3,000 Filipinos die each year because of trans fat-related diseases. Consuming trans fat significantly increases your chance of contracting a cardiovascular disease, which may eventually lead to death. Cardiovascular disease is the leading cause of death of Filipinos, with over 80,000 deaths each year. Makes you wonder, if trans fat is that bad, why is it allowed in the Philippines? One-third of the world's countries have already banned trans fat. And as of 2020, 33 countries have banned trans fat, including the USA, the whole European Union, and even our neighboring countries like Singapore, Thailand, and Taiwan. If we don't have a law that calls for the removal of trans fat from our food supply, we're going to end up as a dumping ground for products filled with this toxic fat. To care for our health, we need to ban trans fat in the Philippines. Let's make the Philippines trans fat free. For more information, visit our website or look for the Trans Fat Free Philippines on Facebook, Instagram, and Twitter.
Did you know that the recently filed Trans Fat Free Philippines bill aims to protect Filipinos from heart disease brought about by consuming trans fat? The Trans Fat Free Philippines bill aims to protect the health of all Filipinos from the harmful effects of trans fat. This bill prohibits the manufacture, importation, distribution, and sale of food products made with partially hydrogenated oils. The bill also prohibits food products whose trans fat content exceeds WHO's recommended limit from being registered with the FDA. Don't worry, there will be a grace period for businesses to reformulate their products. During this time, there will be training and incentives to help micro, small, and medium enterprises switch to healthier alternatives. What are we waiting for? Let's make the Philippines trans fat free. For more information, visit our website or look for Trans Fat Free Philippines on Facebook, Instagram, and Twitter. Did you know that you can help protect Filipinos from heart disease by making the Philippines trans fat free?
Who? Me?
Yes, you. Email your congressman or senator. Ask them to represent you. Tell them to vote for the passage of the Trans Fat Free Philippines bill for the health of all Filipinos.
Can I also write my favorite restaurants, bakeries, and food manufacturers?
Yes, tell them you want healthier, trans fat free versions of your favorite cake, donuts, instant coffee, and milk tea.
Awesome. How can I let my family, friends, and more people know about trans fat and its bad effects in our health?
Let your voice be heard online. Educate your family, friends, and more people about trans fat and its bad effects on our health. Tell them why you support the Trans Fat Free Philippines bill and why they should support it too.
For healthier hearts and healthier Filipinos, a trans fat free Philippines.
Like, tweet, and tag Trans Fat Free Philippines on social media. Tag your senators and congressmen so they can see it too.
For more information, visit the Trans Fat Free Philippines website.
Paano nilalabanan ng bakuna ang sakit? Hinagaya ng bakuna ang virus o bakterya na nagdudulot ng sakit at nagungudyat ng paggawa ng katawan ng antibody. Ang mga antibody ang siyang magbibigay proteksyon sa pagkakataong mahawa ng aktwal na virus o bakterya na nagdudulot ng sakit. Tara, sa Bida Vaccination! Paano nagkakaiba ang mga bakuna? Nagkakaiba ang mga bakuna kung saan ito gawa at kung paano ito naguudyat ng immune response para gumawa ng antibodies. Itong antibodies ay panlaban sa microorganismo na kalaunan ay magiging proteksyon laban sa totoong impeksyon. Ang bakuna ay maaaring pinahina o patay na organismo o isang genetic product tulad ng mRNA na gagawa ng protina ng isang virus o bacteria nang hindi nagdudulot ng sakit. Tara, sa Bida Vaccination! Ano ang maaaring antabayan ng side effects matapos magpabakuna? Maaaring makaramdam ng pananakit, pamumula, pangangati, o pamamaga sa parteng minakunahan na maaaring magtagal ng ilang oras. Lagnat, panghihina ng katawan, pananakit ng ulo, pagkahilo, pagtatae, o pagduduwal. Agad na sumangguni sa isang healthcare professional kung makaranas ng alinman dito. Tara, sa Bida Vaccination! Kailangan bang magpabakuna ang lahat? Hindi sa pilitan ng pagbabakuna, ngunit hindi kahit ng gobyerno na magpabakuna ang publiko para maprotektahan mula sa sakit na maaari namang maiwasan. Tara, sa Bida Vaccination!
Do you know what trans fat is? Trans fat is found in meat and dairy products of ruminant animals like cows, goats, or sheep, or formed by the partial hydrogenation of vegetable oil to achieve a semi-solid form at room temperature. Trans fat is also produced from heating oil in high temperatures and the constant reusing of oil. Trans fat is used to extend the shelf life of food. This is why it's found in almost every meat we consume every day, such as in margarine and shortening, which are added in bread and other baked goods. Fried food like fried chicken, donuts, and some Filipino street food. It is also found in other common food products like 3-in-1 coffee, milk tea, pancake mix, and ready-to-eat meals. Trans fat extends the shelf life of food. However, it makes our own lives shorter. It raises your body's bad cholesterol and lowers its good cholesterol. This may cause clogged arteries, leading to heart attack and other cardiovascular diseases. Trans fat causes a lot of harmful effects to our health, but we can surely do a lot of good to stop it. Let's make the Philippines trans fat free. For more information, visit our website or look for Trans Fat Free Philippines on Facebook, Instagram, and Twitter.
Did you know that the Philippines has no law on the regulation of trans fat? According to the World Health Organization, around 3,000 Filipinos die each year because of trans fat-related diseases. Consuming trans fat significantly increases your chance of contracting a cardiovascular disease, which may eventually lead to death. Cardiovascular disease is the leading cause of death of Filipinos, with over 80,000 deaths each year. Makes you wonder, if trans fat is that bad, why is it allowed in the Philippines? 1/3 of the world's countries have already banned trans fat. And as of 2020, 33 countries have banned trans fat, including the USA, the whole European Union, and even our neighboring countries like Singapore, Thailand, and Taiwan. If we don't have a law that calls for the removal of trans fat from our food supply, we're going to end up as a dumping ground for products filled with this toxic fat. To care for our health, we need to ban trans fat in the Philippines. Let's make the Philippines trans fat free. For more information, visit our website or look for the Trans Fat Free Philippines on Facebook, Instagram, and Twitter.
Did you know that the recently filed Trans Fat Free Philippines bill aims to protect Filipinos from heart disease brought about by consuming trans fat? The Trans Fat Free Philippines bill aims to protect the health of all Filipinos from the harmful effects of trans fat. This bill prohibits the manufacture, importation, distribution, and sale of food products made with partially hydrogenated oils. The bill also prohibits food products whose trans fat content exceeds WHO's recommended limit from being registered with the FDA. Don't worry, there will be a grace period for businesses to reformulate their products. During this time, there will be training and incentives to help micro, small, and medium enterprises switch to healthier alternatives. What are we waiting for? Let's make the Philippines trans fat free. For more information, visit our website or look for Trans Fat Free Philippines on Facebook, Instagram, and Twitter. Did you know that you can help protect Filipinos from heart disease by making the Philippines trans fat free?
Who? Me?
Yes, you. Email your congressman or senator. Ask them to represent you. Tell them to vote for the passage of the Trans Fat Free Philippines bill for the health of all Filipinos.
Can I also write my favorite restaurants, bakeries, and food manufacturers?
Yes, tell them you want healthier, trans fat free versions of your favorite cake, donuts, instant coffee, and milk tea.
Awesome. How can I let my family, friends, and more people know about trans fat and its bad effects in our health?
Let your voice be heard online. Educate your family, friends, and more people about trans fat and its bad effects on our health. Tell them why you support the Trans Fat Free Philippines bill and why they should support it too.
For healthier hearts and healthier Filipinos, a trans fat free Philippines.
Like, tweet, and tag Trans Fat Free Philippines on social media. Tag your senators and congressmen so they can see it too.
For more information, visit the Trans Fat Free Philippines website.
Yun, good afternoon po sa lahat. Okay, so good afternoon po sa lahat. Ayan, welcome po sa ating talakayan. So ngayon po, kasalukuyan po pumapasok pa yung ating mga participants dito naririto sa loob sa National Center for Mental Health. Ngayon pa lang po sobrang nagpapasalamat po kami kasi nakaabot po tayo ng 100 participants. 100 participants po yung nag-sign up dito sa ating virtual talakayan. So again, isa po ito sa mga pinakauna natin ng mga activity na gagawin natin. As part ng health promotion natin at this time naman po gagawin natin to. Pag-uusapan po natin, kakamustahin natin ang ating mga puso. Ayan, so nakikita ko na po dumarating ng ating mga participants pa at yung ating mga speakers. So good afternoon po again. wini-welcome po namin kayo dito sa ating virtual talakayan. Ano po, so kasama po natin dito ang buong cardiology section ng Department of Internal Medicine ng ating Pavilion 7 or ng ating NCMH General Hospital. Okay. So at this point, parang nakikita ko po yung iba naka-off cam pa. It's okay po if ever na para makapagtipid tayo ng ating bandwidth, ng ating connection. Ayan, pero mamaya po siguro mag-request tayo para sa ating photo ops para dun sa may mga camera, para makita naman natin yung ating mga participants. So as of now po dito sa ating Zoom room, meron tayong 53 na participants, but I understand na minsan po yung isang camera o isang gadget ay meron po tayong mga kasama doon na mas maraming mga participants. Katulad na lang po ng mga kasama natin na nasa admin conference. Dun sa admin conference para po dun sa iba nating mga participants na gustong makasali sa ating talakayan, but medyo may problem pa on their technical on their gadgets. So iba pong mga participants natin na siguro yung mga taga NCMH diyan na hindi makapasok through Facebook Live o dito sa ating Zoom room, pwede kayong pumunta sa admin conference pero may limit lang po tayo doon for our physical distancing na hanggang 10 to 15 participants lang po sa ating admin conference. Ayun, so good afternoon po. Ayan, nakikita ko bumabati na si Ma'am Grace. Nasa ngayon nasa Pavilion 7 ICU. Yan, good afternoon po. Good afternoon po, Doc Vic. Ayan, Dr. Pondabella, andito na rin po sa ating Zoom room. Nandito na rin po si Ma'am Mel Basia, sa ating nasa Pavilion 2. Ayan, good afternoon po. Ma'am Chona Aguilar, good afternoon. Ma'am Flor, nandun sa ating Health Epidemiology and Surveillance Unit. Good afternoon po. Ma'am Agnes Trinidad, isa sa mga pinakamaaga natin na kanina pang gustong makapasok sa ating Zoom room. Sir Aaron, good afternoon po. Ayan, Sir Aaron, good afternoon. At sa ating Facebook Live, alam ko isa sa pinakamaaga na nandito. Ayan, nandito sa ating Facebook Live, nandito pinakamaaga si Ma'am Arceli Mendoza. Good afternoon po. Ayan, good afternoon din po. Ma'am Jaysa Panlilio, ayan, sa ating iHome. Maraming salamat po sa support. Good afternoon din po, Ma'am Mavic Atanasio. Ayan, good afternoon po sa inyo. Sa ating Zoom room naman, nakikita ko ngayon si Sir Roel Mistica. Good afternoon po. Ngayon ay nasa outer space. Ano ba yan? Sa universe na ba yan, Sir Roel? Good afternoon po. Ma'am Ivy, nakikita ko din. Good afternoon po. Ayan. So I think si Ma'am Lilibet. Yan, nakikita ko din si Ma'am Lilibet. Naka-on din ang kanyang camera. Ayan, sino pa ba? Ayan, si Ma'am Susan, isa sa pinakamaaga din natin na participants po. Ma'am Susan Legaspi, good afternoon po. Ma'am Jenilit Cudal, good afternoon. Ang number 1 natin na nag-register sa ating talakayan. Okay, so we have as of now po 1:34 na tayo. I mean 1:34 PM na. Ayan, so at any moment po mag-start na po tayo. And then ayan. Pumapasok sila. Ma'am Elizabeth Rendo. Ma'am Elizabeth Rendo, good afternoon po. Ayan, si Ma'am Rachel Ann Malagutnot, maraming salamat po. I think from the dialysis clinic, good afternoon po. Ma'am Jella Eusebio from Pavilion 1, good afternoon po. Ayan, so again, this health promotion activity is approved by our medical center chief at ng ating mga chief of clinic. So talagang lisensyado po tayong umattend sa ating Zoom room. And I understand para dun sa mga gadgets po na nandun sa mga pavilions, pwede nyo pong i-share, panoorin itong ating talakayan, isang mapusong talakayan. At tandaan po natin, we are also live on Facebook. So para dun sa iba nating makasamahan na maaring hindi natin on time o parang real time na makakasama, ay pwede pa nilang mapanood ang ating talakayan dahil talagang maswerte po tayo dahil nandito buong persa po ng ating cardiology section sa panguna siyempre ng head ng cardiology section si Dr. Joseph Raymond Quaresma. Ano po? So lahat ng ihanda rin yun po yung mga katanungan nyo dahil handang-handang sagutin niya ng ating mga cardiologist. At syempre, hindi rin papahuli, ano po ang ating psychiatrist naman na magdi-discuss sa isa sa mga topics natin this afternoon, Dr. Kenneth Europa. Ano po? So salamat talaga kila Dr. Giyang and Dr. Andrada dahil pinayagan po natin na makasama si Dr. Kenneth. Ayan, and si Doc Zen, Doc Shi, ayan, nandito na din po sila. Siyempre po, acknowledge din natin, good afternoon din po, Dr. Fidel Kaligayahan, ano po, the head or the chairperson of the Internal Medicine Department of Pavilion 7. Ayan, kanina po nabagay ko na rin si Doc Vic, ano po, Doc Victor Pondabella, Dr. Victor Gerardo Pondabella, ang ating chief ng NC Mitch General Hospital. Good afternoon po. Ayan, Sir Archie Likwanan from Pavilion 7 ICU. Good afternoon po. Si Ma'am Regina Balbidas. Good afternoon din po. Okay, so 1:37. So acknowledge ko na lang din po yung iba na medyo tahimik pa sa kanilang siguro tahimik pa sa good afternoon. Hello po. Hello Doc Vic. Ayan, si Ma'am Jen nandito na rin, Sir Christian Castillo, Sir Arvin, Ma'am Mary Jane Castro, ano po? Ma'am Agnes Trinidad, good afternoon po. Ma'am Monica, Ma'am Hides, ayan, Ate Hides, good afternoon. Sir Brian, Sir Arlie, Sir Eugene Medina, Ma'am Carla Camille Victa, ayan, makasama natin sa activity therapy section. Good afternoon po. Si Ma'am Bernadette Ninyalga, ano po? Good afternoon ma'am. Ma'am Jewel, good afternoon po. Salamat po sa pinadala niyong lunch kanina sa ating taga-nutritionist, nutrition and dietary section. Oh, sorry, parang mali ako doon. Ayan, so good afternoon po din Ma'am Christine Domingo. Ayan. Oh, naririnig ba ako? Sabi ni Ma'am Christine Domingo, naka-mute daw yung mic ko. Pero tama ba? Baka naririnig naman daw po. Ayan. So again, this is one of the limitations ng ating talakayan, ng ating activity na ito. Maaring mahina lang po yung connection natin, but again, this is one of the limitations po na kailangan nating tanggapin. Pero ang pinakang importante, despite yung physical distancing na ginagawa natin, still ay binibigyan pa natin ng panahon para matuto tayo at syempre sabi natin itong usapin sa puso, napakahalaga po nito lalo na ngayon na mayroong pandemya. So malalaman natin yung epekto ng pandemya sa ating mga puso. Kumusta po ba yung ating mga puso? Yan. Parinig naman ako dyan sa ating chat room. Kumusta po yung mga puso ninyo? Ayan. At kung sakaling may sumasakit na puso, ayan, physical, siguro masasagot ni ng ating mga cardiologist. Tapos siguro pag mga ibang sakit sa puso, nandiyan naman si Dr. Kenneth Europa. Na masasagot sa atin, baka ibang klaseng sakit ng puso. Sir Allen, good afternoon po. Sir Cons Paubsanon, good afternoon po. Nandito na din siya. Sir Norman and Ma'am Cecil, nandito sila. Ma'am Aisa, ayan. Ma'am Jennifer, good afternoon po. Ayan. So kanina nakita ko din na nag-sign up si Ma'am Susan Sabado. Siyempre po, ang ating chief ng psychological section. Yan. Sila Ma'am Ellie sa procurement section. Sugatan daw! May nagsabi dito sa chatroom, daw sugatan? Sugatan ba talaga, Doc Vic? Ayan, tingnan natin kung paano ma-heal ang mga sugatang puso. Sabi ni Sir Roel Mystica, always in love. Yan, always in love. Check ko naman dito sa ating Facebook Live. Baka may sumagot. Hi, Sir JM po. From Camarin. Wow, good afternoon po. From the islands of Camarin daw. Good afternoon po. Ma'am Lani Sanchez. Ma'am Leilani Akyot, good afternoon po. Ayan, si Ma'am Ana sa ating Pag-asa Hall, good afternoon po. Matabang puso. Yan, sabi ni Ma'am Susan De Los Reyes. At heart. Yan, heart daw po, sabi ni Ma'am Sona. Ayan. So, ang oras po sa akin is 1:40 p.m. Ayan. And with that po, ay mag-start na po I know paparating pa po yung ating mga ibang participants, but with 1:40 p.m., we are formally mag-start po tayo. At syempre po para i-bless yung ating activity na ito this afternoon. Ano po? So, gagawin po natin ang ating opening prayer at susundan po ng ating national anthem. Okay, so makikita niyo po sa screen ang ating prayer. Ramdamin lang po natin kung ano yung epekto nung mapapanood natin ng mga music video ano po para sa i-bless ang ating activity. Yan. I'm sorry, naka-ano pala ako, naka-mute pala ako. Again po, welcome po para dun sa iba pa nating mga employees po na nakapasok after our opening prayer at ang ating national anthem. As a simple rule po, paki-check lang po na dapat lagi naka-mute po tayo. And then para po makuha natin ang inyong certificate ay hintayin po na ma-send sa inyo ang post-evaluation na ibibigay natin after ng ating talakayan. At para naman po makuha yung ating mga freebies, sikapin lang po natin na maging active sa ating chat box at mag-participate doon sa ating mga tanong na ibibigay mamaya. And again, kailangan mag-enjoy po tayo. Ayan, makinig, matuto, and then later po sikapin natin na i-share kung ano man yung ating matututunan this afternoon. Again po, as a limitation, if ever po na ma-disconnect kayo, pwede naman po natin yan sign in lang po kayo ulit at i-admit po kayo. And para dun po naman sa iba, you can also check po kung nangyayaring talakay natin sa ating Facebook, sa ating NCMH Public Health Unit Facebook page. Tanggapin natin yung mga technical problem po na mga ganyan. And as I observe din po, merong delay lang po when it comes to yung live na nangyayari sa ating Facebook. Okay? So tanggapin po natin yung mga limitations na yan. At I'm sure with the blessing na nangyari kanina ay malulhati nating matatapos itong talakayan na ito. At ngayon naman po, para formal na i-open ang ating talakayan, i-welcome po natin para sa opening remarks. Ngayon po ay tinatawagan po natin ang head o the chairperson of the Department of Internal Medicine, Dr. Fidel Kaligayahan. Ayan, nasa na si Ayan. Hi, Doc.
Hello.
Good afternoon po. Naka-unmute lang si Doc, no? Ay, sorry, naka-mute si Doc.
Wait lang. Okay, naka-unmute na ako. Hello. Good afternoon. JM.
Ayan, so parang nagkaroon ba tayo ng technical problem?
Unmute na ako dito. Tinig na ako dyan.
Ayan. Good afternoon, Doc.
Good afternoon, JM.
Okay na po. Clear na po, Doc.
Okay na. Okay. So, opening remarks na tayo. Good afternoon, fellow doctors, fellow NCMH employees. Today, NCMH Department of Internal Medicine, Section on Cardiology, will be presenting interesting and related topics in coronary artery disease and depression. These related medical conditions and psychiatric conditions are frequently seen by our staff in our facility. In light of that, Dr. Oyek, Dr. Jenilyn Oyek, Dr. Che Salcedo, and Dr. Joseph Quaresma, and our psychiatrist, Dr. Kenneth Europa, prepared some lectures and discussion for you, which is also parallel with the Petro Learning and Development programs. I hope everybody will be listening attentively and allowed to share and participate as we go on with our learning activity for today. So stay and keep alert, listen and learn, just like what JM said. And I thank you. So we can start. Thank you.
Hey, thank you very much, Doc. Yan. You are the best. May ganun pa. Good afternoon, Doc. Maraming salamat po. Ayan. At salamat po sa support na laging binibigay niyo po. Maraming salamat po sa Department of Internal Medicine sa buong cardiology section. Salamat po. Ayun. So sabi nga ni Yes, Doc. So sabi nga ni Dr. Kaligayahan, dapat daw mag-stay alert daw po tayo. So siguro mag-start lang tayo mga sandaling pagalaw-galaw lang na. Pwede bang ma-request natin yung mga participants natin this time na mag-on cam, paki-on po yung inyong mga camera. Ayan. Paki-on po ang ating camera. At kahit na magkakalayo tayo, ayan, ano bang nakikita natin? Ano ba nakikita niyo ba? Marami ng naka-on yung camera. Nakikita ba 'yun sa ating Facebook Live? Ayan. So I think baka medyo challenge siya, no. Pero yung idea natin sa ating camera, magtuturuan lang ako sa inyo kasi 'di ba ngayon buwan ng mga puso. So turuan ko lang po kayo ng 30 seconds lang ito para kapag nakita kong medyo sa camera na inaantok na kayo ay magising po kayo. So ayan, kasama ko si Doc Kaligayahan ngayon, nakikita ko siya. So sa tune ng mamaya paparinig sa atin ni Ma'am Shell, turuan ko muna kayo ng ating choreo. So dahil puso po, ready po tayo pump sa ating bahagi ng puso. Bilang tayo ng mga 8. So 1, 2, 3, 4, 5, 6, 7, 8. Ayan, very good. Next po, next choreo natin is side. 1, 2, 3, 4, 5, 6, 7, 8. Yan, ang galing din na sa ating admin conference, no? And then third po, balik natin sa pump natin sa puso. 1, 2, 3, 4, 5, 6, 7, 8. Pagkatapos nun, turo sa harap. Sa'yo, 2, 3, 4, 5, 6, 7, 8. And kaya, 1, 2, 3, 4, 5, 6, 7, 8. And then look up. 1, 2, 3, 4. Kabila. 5, 6, 7, 8. Okay, ngayon lalapatan natin ng tugtog. Okay? Sabay-sabay tayo. Kitang-kita ko si Doc Kaligayahan, yung ating nasa admin conference. Kuwang-kuha po nila yung choreo. Si Ma'am Shell na nandito rin sa ating community. So now bigyan natin ng music, ma'am. Lapatan natin ng music. So walang copyright ito. Nagpaalam tayo kay Donna Cruz. Naririnig ba? Okay, so yan po yung tugtog natin. Ready? Go! 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, and 1. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, and 1. And 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, and 1. Okay? So mamaya po, gagawin natin, ulit natin yan. I understand, pero may delay lang tayo dun sa ating music. Pero mamaya, on the spot, malalagay kayo dun sa baka sa Zoom room makita yung video ninyo. Maraming salamat po. Okay. Again, maraming salamat po sa inyong participation. At ngayon po, ay pupunta na tayo sa ating pinakang unang topic. Okay. So again, paalala ko lang po, siguraduhin natin na makinig tayo kasi mamaya po ay babanggitin namin kung sino ang unang mananalo sa ating ng ating mga freebies. So ngayon po, ayan, para konting excitement lang po natin, ito po yung mga klase ng pamimigay natin. Wala mga live selling natin mamaya para dun sa mga active participants natin. Ito pong mga journal na to. Ayan. Pwede rin po kayong makakuha ng Kumusta ka, Mags? Ayan, kumusta ka, Mags? Ayan. Ayan, baka naman daw sa early bird, sabi ni Ma'am Agnes. At cellphone load. Ayan, so maging attentive lang po tayo sa discussion. Dagdag na pampagising pa para maging alert nga daw tayo, sabi ni Dr. Talakayan. Okay, so eto na. Ito na. Ayan, nag-on na rin sila. So para po sa ating unang topic, ngayon po ay pinapakilala ko po sa inyo ating medical specialist 2 sa ating cardiology section to discuss hypertension, obesity, and inactivity as risk factors for coronary artery disease. Welcome po natin, Dr. Jeneline Oyek. Take it away, Doc.
Hi, good afternoon po. Hello?
Ririnig po namin kayo, Doc.
Naririnig niyo kami, sir? Naririnig niyo ako, sir?
I-share ni Doc ang kanyang slides.
Wait lang, sir.
Sure, Doc.
Share.
Okay.
Okay. Good afternoon po. I'm Dr. Oyek and I will be discussing about hypertension, obesity, and inactivity as risk factors for coronary artery disease. So first, sorry, nag-hang. Wait lang po.
It's okay, Doc. Sabi nga natin kanina, isa yan sa mga technical difficulties na kinakaharap natin at tatanggapin natin ngayon this afternoon.
Sir JM, ayaw.
Okay.
Yung PowerPoint na lang po sa inyo. Ayaw.
Sige po. Pwede naman yun, Doc. Pwede naman yun, Doc. So, Ma'am Lichelle is now preparing po the slides for
Ito na,
Dr. Jen.
Ito na, sir. Okay na po.
Oh, it's okay na?
Sige.
Ma'am Lichelle, okay na pa. It's okay, Doc. Thank you.
So first, what is coronary artery disease? Sir, nawawala. Sir, ayaw na naman.
Sige pa. So I think si Ma'am Lichelle po is now preparing the slides. Ano po? Ayan. Okay naman yun, Doc. Basta ang gagawin natin habang hinihintay natin si Doc, pwede naman kamustahin muna natin si Doc Jen. Doc Jen, kumusta naman ang puso mo?
Okay naman, sir.
Okay naman. Parang big nung okay naman. Basta tumitibok. Ayan. So, ayun na.
Ito, okay na ba, sir?
Yes po.
Ngayon, okay
Ma'am
ulit.
Lichelle po is now, prepare. Ayan. Okay.
Sir, okay na ulit. Okay na ba to?
Yes,
Minsan
yes. I think si Ma'am Lichelle na po yung magkocontrol ng ating slides.
Ito, sir, nagkaano na yung sa akin. Okay lang po ba to? Nakikita
It's
po?
okay. Yes, Doc.
Okay, sige. Coronary artery disease. So what is coronary artery disease? It is caused by the plaque buildup in the walls of the arteries that supply blood to the heart. So as you can see on the image on the left side, it is a normal artery. And on the right side, you can see lipid deposit of plaque, which causes the narrowing of artery. So that's the coronary artery disease. So what are the modifiable risk factors for coronary artery disease? You have obesity, the lack of physical activity, hypertension, smoking, hyperlipidemia, which is increased cholesterol, and diabetes mellitus. So other factors which are non-modifiable risk factors such as aging, male gender, which is more at risk than women, and genetic predisposition. If your parents have coronary artery disease, you have a more predisposition to have coronary artery disease. So hypertension, it still continues to be the most common preventable cardiovascular risk factor for cardiovascular events. So hypertension is defined as a persistent elevation in office BP of 140/90. So pag ang BP niyo po is 140/90, high blood na po kayo. This is equivalent to the ambulatory BP monitoring of 130/80. So what's ambulatory BP monitoring? Meron pong device na ikakabit sa inyo na magmo-monitor ng blood pressure nyo for 24 hours. So if 130/80, yun po yung equivalent ng clinic 140/90. And also the home BP monitoring, which is 135/85. So kapag ang BP niyo po sa bahay na minomonitor niyo is 135/85, equivalent na po yun sa high blood na 140/90 sa clinic blood pressure. So according to the ESC guidelines on hypertension, so ang optimal po is 120 and below. So 130 to 139/80 to 89, high normal siya. So ang high blood po na stage 1 is 140/90. So pag 140/90 na po yung blood pressure ninyo, high blood grade 1 na po kayo. Then for the hypertension stage 2, if the blood pressure is 160/100, hypertensive grade 2 na po kayo. Then if the blood pressure is 180/110, your hypertensive grade 3. So ano naman po yung isolated systolic hypertension? If ang systolic BP or yung up is 140 and above pero yung over is normal. So isolated systolic hypertension po yun. So we also have the white coat hypertension. So what is white coat hypertension? It is an elevated office blood pressure. So pag pumunta po kayo sa clinic, tapos ang BP nyo is 140 and above, pero pag umuwi po kayo sa bahay is at normal naman, so meron po kayong white coat hypertension. So parang natatakot kayo sa doktor or nagiging anxious kayo pag nasa clinic po kayo. So ano pong ginagawa pag merong white coat hypertension? Patient is advised to undergo the 24-hour ambulatory BP monitoring. So yun nga po, meron ikakabit sa inyo na blood pressure machine na magmo-monitor ng BP nyo for 24 hours para po ma-check kung totoo po na high blood po kayo. So kung meron po tayong white coat hypertension, meron din po tayong mask hypertension. So ano po yung mask hypertension? It is normal ang clinic BP po ninyo, pero pag umuwi po kayo, ang BP po ninyo is mataas. So parang false normal po pag nasa clinic kayo. So ano pong ginagawa? Naglalagay rin po ng machine, magto-24-hour BP monitoring pa rin po kayo para ma-make sure po natin kung high blood po talaga kayo or hindi po kayo high blood. So early detection is the key and all adults should know their blood pressure. So what do we do with the high BP? So we have the lifestyle modification. So for the dietary sodium restriction, iwasan po natin yung salty food. If less than 2.4 grams per day, ang anticipated po na baba ng blood pressure is almost 4.8 na baba sa BP nyo. Pag naman po nag-weight loss kayo, per pound or half kilo na malulus ninyo, 1 millimeter po yung ibababa ng BP ninyo. If nagda-dash diet kayo, high in vegetable, fruits, low sa fatty food, 6 po yung expected na ibababa ng blood pressure. And kapag nag-exercise po kayo at least 40 minutes of moderate intensity exercise, 3 to 4 times a week, 4 to 6 naman po yung ibababa ng blood pressure ninyo. And for the alcohol intake, if women, 1 drink per day lang, and for men, 2 drink lang per day, 2 to 4 po yung pwedeng ibaba ng blood pressure po ninyo. So for many people, lifestyle changes are sufficient to control blood pressure, but for others, medication is required. Inexpensive medication exists, which is effective when taken as prescribed. So for the next risk factor, we have the obesity. So what are the causes of obesity? First, we have the environmental factors, so the lifestyle behavior, like what you eat and how active you are on an average day. Another factor would be psychological factors. Eating can be linked to your emotions. For example, if you're happy, you binge eat. When you're sad, you also binge eat. So when you eat too much, it will cause you obesity. Another one is genetic and environmental factors. So obesity can run in your family. So if you have parents who are obese, brothers and sisters who are obese, you have an increased risk of being obese also. And also other medical conditions such as hypothyroidism, Cushing syndrome, or you're taking steroids, it can also lower your metabolism, which can cause obesity. So for the waist circumference, it is an indicative of health risk. So for men, if your waistline is more than or equal to 40, and for women, 35 inch, it is indicative of health risk. So hindi na po siya maganda. Pag ganyan na po kalaki yung waistline po ninyo. So for your BMI or body mass index, you should measure for that. So what is body mass index? It is weight in kilogram over height per meter. So for example, your weight is 60 kilogram over, for example, you're 5'4", so divided by 1.6 meters, so you'll get your body mass index. So what is the body mass index for? So this is the weight categories based on the body mass index. So if your body mass index is less than 18.5, you are underweight. So our target of normal BMI is 18.5 to 24.9. So that's the normal and healthy body mass index. If you're 25 to 29.9, you're already overweight. And if you're 30 to 39.9, you are obese. And if it is more than 40, you are severely obese. So our target is 18.5 to 24.9. So as you can see on this graph, for obesity and cardiovascular risk, the higher your body mass index, or if you're obese, you have a higher risk of having a heart attack. So we should maintain a normal body mass index. So what are the recommendations for obese people? You reduce your calorie diet, you increase your activity, your behavior modification, and surgery, which is reserved for severely obese patients. So for weight reduction, for example, you have required daily intake of calorie of 1,500 calorie per day. To lose 1 pound per week or half kilo per week, you need to lessen your calories of 500 per day. So if your required intake is 1,500, pag gusto mong mag-lose ng half kilo per week, dapat 1,000 calories ka na lang per day para mabawasan yung timbang mo ng 2 kilos per month. So you should minimize fats, sugar, salt, and alcohol. Have more on protein and more vegetables and fruits in your diet. And also make it a habit to check the nutrition facts or labels of the products that you buy in the groceries. So para po alam niyo kung ilan yung calories, para makapag-calorie counting po kayo, para pag lulus kayo ng weight or nagda-diet kayo, alam niyo po kung ilan yung dapat niyo lang kainin. So kung 1,000 calories lang kada kinakain po ninyo, i-measure nyo, for example, rice, nasa 200 calories po siya. So kung ang target nyo is 1,000, malilimit nyo po yung kinakain ninyo. So the recommendation is regular assessment of your body mass index and waist circumference. So the normal nga po is 18.5 to 24.9. The recommended initial goal weight is 10% of baseline weight. So kung nagda-diet po kayo, ang initial goal is 10% kung obese kayo of your baseline weight in 6 months. And kailangan niyo po talaga ng treatment and lifestyle changes kapag sobrang laki na po ng waistline ninyo, 40 na sa lalaki and 35 inch na po sa babae. So the other risk factor is physical inactivity. So physical inactivity is being physically inactive or sedentary, which can lead to heart attack and stroke. So physical inactivity or being sedentary is when you don't move too much or you just sit lying on the sofa watching TV or sitting at the desk or doing computer works. So less active person have a 30 to 50% greater risk of developing high blood pressure And physical inactivity is a significant risk factor for cardiovascular disease itself. It ranks similarly to smoking, high blood, and elevated blood cholesterol. So why you should be more active? Because it helps you control the blood pressure. It reduces your bad cholesterol and increases your good cholesterol. It also reduces your blood sugar, so you reduce your risk of diabetes. And it increases the number of calories you burn so that you will lose fats and you will have a healthy weight. So what is the recommendation for activity? The American Heart Association recommends 30 to 60 minutes of aerobic exercise 3 to 4 times a week. So the moderate activities include walking, climbing stairs, gardening, moderate to heavy housework, dancing, and home exercise. Other more vigorous activities are brisk walking, running, swimming, bicycle, roller skating, and jumping rope. So ang recommended po is 3 to 4 times a week ng moderate activity, which is 30 to 60 minutes. So mga 1 hour po kayo mag-exercise 3 to 4 times a week para po maging healthy. Thank you.
Okay. So, thank you, Doc Jen. Ano po? So, again po, ipapaalala lang natin na yung mga questions nyo po dun sa mga nabanggit ni Doc Jen ay i-raise po natin after po na makapag-discuss yung ating mga speakers. Pero at least yung nakuha ko doon, is that yung tungkol sa hypertension, that there is the white coat and the mask hypertension, ano po. And then another risk factor is the obesity and yung physical inactivity. So narinig ko doon na yung mga nasa opisina, yan, yung mga physically mga inactive po, more chance or mas malaki na risk na magkaroon ng coronary artery disease. Okay, so ano lang po yun, binato ko lang po, but again, ulit sa Pavilion 2, taga Pavilion 2 Assets, and saka po si Sir Joseph naman ang nakakuha ng ating journal. So congratulations po para sa first batch ng ating winner. Later po, pwede namin i-flash din sa screen kung sino-sino po yung mga nanalo ng ating journal. Ayun. Ayan, si Ma'am Jenelit Codal and si Sir Joseph Rome Ramos. Si Ma'am Jenelit Codal po from Pavilion 2 Assis and si Sir Joseph Rome Ramos naman po from Pavilion 2 Emergency Room. Okay. So ngayon po, ibabato ko lang sa inyo yung ating unang question na patungkol dun sa diniscuss ni Doc Jen. Ano po, i-ready po ninyo ang inyong chat box para po sa mananalo. Para sa mananalo ng load worth 100 pesos. Ayan. I-ready po natin ang ating chat box. Binibigyan ko ng pagkakataon ng lahat na mag-ready sa kanilang chat box para ikiin ang kanilang sagot sa tanong na, ayan. Ano yung unang tanong natin, Ma'am Lichelle? Okay. Give 3 risk factors of coronary artery disease na discuss ni Dr. Jen kanina. Okay, so pasan po. Kailangan 3 risk factors, Sir Eugene. Dagdagan mo pa. Obesity, hypertension, diabetes. Wow, kompleto na yun. Okay. Okay, and then later po, babanggitin namin kung sino ang maswerteng nanalo ng ating 100 pesos na load. Okay, so ngayon po, mag-ready na tayo para sa ating second topic. Ayan, we're now are preparing para sa ating second topic. Ayan, thank you po sa inyong mga sagot at later po i-verify ng ating technical team kung sino ang mananalo ng ating 100 pesos na load. Ayan po, yan po ay sa ating nasa Zoom room at nasa ating Facebook Live. At ngayon, para sa ating susunod na topic. At para po sa ating susunod na topic to discuss the management of coronary artery disease risk factors in COVID times, welcome po natin ang head ng Cardiology section, Dr. Joseph Raymond Quaresma.
Hello, good afternoon to each and everyone.
Doc, good afternoon po. Naririnig po kayo. Kumusta po ang ating puso, Doc?
Okay naman, okay naman.
Doon muna tayo. Uy, may na-preempt yung yung certificate ni Doc. Yes, Doc. Sige po, you can share the slide.
Okay.
Okay,
Everyone,
Doc.
can everyone hear me? JM, can you hear me?
Yes, Doc. Loud and clear po. Thank you.
Can you see my slides?
Yes, Doc. Nakikita po namin.
So I'm going to start my talk. Good afternoon to each and everyone. I am Dr. Quaresma, and my task for this afternoon is to discuss how to manage CAD risk factors during this COVID-19 pandemic. So as you could see, as a review, it has been a year since we started this pandemic. So these dates remind us, these important dates remind us of how it started, no? So it was on March 11, 2020, wherein the WHO characterized COVID-19 as pandemic, but it was as early as December of 2019, wherein we have documented the first case of COVID in Wuhan, China. So as you could see, these are the presentations ng COVID-19. Most of them are in the mild form of symptoms, but about 5% of them would have developed critically ill. No? Ito po yung mga pasyenteng na-intubate, natutubo, at nailalagay sa medical ICU. So these are the established comorbidities according to the Center for Disease Control that they have established these risk factors for developing severe COVID-19 infection. Ibig pong sabihin, pag kayo ay meron pong ganitong comorbidities, may chance po na kayo po ay magkaroon ng severe type ng COVID infection. Diniscuss na po kanina ni Dr. Oyek ang pagiging obese, no? Ang pagkakaroon ng sakit sa puso, at in addition, doon po sa mga taong may cancer, may chronic kidney disease, yung po nagdadialysis, these people would have an increased risk for developing severe type of COVID-19 manifestations. So aside from that, no, aside from those established comorbidities, these are added comorbidities what would have developed in patients with severe COVID-19. So those with cerebrovascular disease, yung pong mga taong na-stroke, yung pong may hypertension as discussed by Dr. Oyek, doon po sa mga buntis, so mag-iingat po mga taong buntis, at may diabetes, no? So as a review po, ito po yung SARS infection, no? Usually ang virus po ay nagbabind sa tinatawag na angiotensin converting enzyme 2, yung ACE2. Ito po ay makikita sa lungs wherein it facilitates the entry of cell. So it has been hypothesized that yung renin-angiotensin-aldosterone system inhibition may upregulate your ACE expression, thereby increasing viral entry and replication. Kaya ko po didiscuss to mga itong bagay kasi mahalaga po to sa mga tao may hypertension at mga nagtitake ng gamot para sa hypertension. So this is one criteria kung saan ang virus ay pumapasok sa lungs because of this ACE receptor. On the other hand, so sinabi ko po kanina, yung ACE receptor can increase yung facilities ng pagpasok ng virus. On the other hand, itong mga ACE receptors reduces the level of angiotensin 2, which is a potent pro-inflammatory agent in the lungs and can contribute to lung injury. And therefore, yung mga gamot na nag-inhibit sa RAS may block the production or function of angiotensin 2 and potentially also increase the level of ACE2, thereby indirectly inhibiting angiotensin 2. So anong ibig sabihin po nito? Ito pong ACE inhibitors na to, sinasabi sa mga dalawang factor o dalawang sinabi kong fact, is yung isa, maaaring makalala ng COVID-19 at sa kabilang dako, pwede naman daw po itong makatulong sa COVID-19. Kaya ko po sinabi itong mga bagay na to kasi usually ang mga gamot po sa hypertension ay ACE o ARB blockers. No? Ito po yung enalapril, losartan, candesartan, at captopril. Isa lang po ito sa mga example ng mga gamot sa hypertension. So, kaya ko po sinabi ito kasi pwede po natin itanong kung tayo po ay hypertensive at tayo po ay umiinom ng ganitong klaseng gamot at nasabi nga po na maaaring makasama sa COVID. Should I stop the drug? Should I continue the drug? Di po ba? Magandang katanungan po ito. So, minention na po ni Dr. Oyek ang definition ng hypertension. At minention rin po niya na kailangan po natin i-control ang hypertension. Pero, ang maintenance po ng hypertension, gamit ng mga gamot nito, there is still no clear potential harm with withdrawing this type of medicine in patients with heart failure with otherwise stable condition. And these RAS inhibitors, ito pong ACE inhibitor and ARB blockers, have established benefits in protecting the kidney, the myocardium in patients with heart failure, and thereby we should not continue them. Ibig pong sabihin, kung tayo po ay may maintenance na sa puso, specifically itong ARB at ACE, wag po natin ito ititigil. Dahil po, sinabi po dito sa data na to sa China, no, about 1,128 patients with COVID-19 na hypertensive. Doon po sa mga pasyenteng may ACE and ARB, mas mababa po sa kanila ang namamatay. Ibig pong sabihin, mukhang may protective value po itong mga gamot na to against COVID-19 para po tayo hindi magkaroon ng komplikasyon at lumala at tayo po ay mamatay sa COVID-19. So according to this study, doon po sa mga may maintenance na hypertensive at naka-ACE ARB, mas mababa po ang chance na sila po ay mamatay compared to those without ACE or ARB maintenance medication. So according to the American College of Cardiology, minention po ng aming asosasyon sa Amerika na there is no experimental or clinical data demonstrating the adverse effect outcomes of this medicine. This ACE and ARB antagonists in COVID-19 among with history of cardiovascular disease treated with these agents. So thereby, we should continue taking all of this medicine who are currently prescribed unless contraindicated. Okay? So according to the European Society of Cardiology naman, so hindi lang po Amerika nagsasabi, even the Europeans have mentioned that there is a lack of evidence supporting the harmful effect of ACE and ARB in the context of pandemic COVID-19 outbreak. And therefore, this medication should be continued at hindi po tinitigil. Okay? Sa Amerika, no, sinabi na sa Amerika, sa Europa, sa Pilipinas naman, our very own Philippine Society of Hypertension, they are also not advocating the discontinuation of this medicine because as long as your BP is controlled, we should continue all of this medicine. Okay, so these are the cardiovascular complications of COVID-19. So kung ikaw po ay may COVID-19, ito po ay maaaring maging masamang epekto nito sa puso. Isa dito po ay pwede po kayong magkaroon ng heart attack, pwede po kayong magkaroon ng heart failure, at pwede rin po kayong magkaroon ng irregular heartbeat or arrhythmias. So isa lang pong ibig sabihin nito, kung kayo po ay may sakit sa puso at kayo po ay nagkaroon ng COVID-19, mas mataas po ang risk na kayo po ay magkaroon ng komplikasyon at mamatay dahil po sa COVID-19 because of this cardiovascular complication. So how about diabetes? No? Pag ikaw po ay diabetic, I was diagnosed to have diabetes mellitus. Am I at risk to have infected with COVID-19 infection? Di po ba? Magandang katanungan po yan. So ito pong data na to, nagsasabi po na marami pong effects ang COVID-19 sa mga taong may diabetes. So pag kayo po ay diabetic at nagkaroon ng COVID-19, yung virus po mismo can lead to increased level of inflammatory mediators in the blood, including your lipopolysaccharides, inflammatory cytokines, and toxic metabolites. This will lead to reactive oxygen species activation would lead to hyperglycemia and cause insulin resistance. Ibig pong sabihin po, pag kayo po ay diabetic at magkaroon ng COVID-19, mas lumalala po ang pagtaas ng kanilang sugar levels. At dahil po dito, nagkakaroon po ng mas madaming komplikasyon leading to acute lung injury and acute respiratory distress syndrome, leading to cardiovascular events, leading to thromboembolism, and DIC. So ultimately, ang sinasabi lang po ng slide na to, yung po mga taong diabetic at nagkaroon ng COVID-19, mas malala po ang tama sa kanila ng virus. Kaya po tayo ay mag-iingat, lalong-lalo na sa mga taong diabetic. No? So however, the American Diabetes Association have mentioned that there's not enough data to show whether people with diabetes are more likely to get COVID-19 than in general population. So hindi ibig sabihin diabetic ka, mas magkakaroon ka. Kaya lang, pag nagkaroon ka at diabetic ka, mas delikado po yon. Kaya tayo po ay mag-iingat. The problem people with diabetes face is primarily a problem of worse outcomes. So they have worse outcomes. Sila po yung mas malala. Sila po yung mas nagkakaroon ng komplikasyon. So people with diabetes have higher rates of serious complications and death than with people without diabetes. So please remember this, no? Older people are also at higher risk. And that is why our government is trying hard na yung mga elderly, more than 65 years old, hypertensive, diabetic, sila po yung talagang high risk. Sila po talaga yung inuuna sana na bigyan ng bakuna dahil sila talaga yung pinakadelikado sa mga komplikasyon ng COVID-19 infection. So, however, itong pagkakaroon ng COVID-19 sa mga diabetic, dapat po mapag-control pa rin po ang kanilang sugar. So, because patients with diabetes may also have other comorbidities. And that is why it is imperative to follow COVID-19 precaution and prevention guidelines. So talaga mag-iingat po tayo. And of course, we have to continue our prescribed medications. And we have to consult our endocrinologist. Siyempre, I'll shout out ko po si Dr. A.O. Felipe, our endocrinologist sa ating mental hospital. So there is a potential pathologic link between COVID-19 infection and diabetes, and that is why we have to be careful and we have to upregulate our control in glucose levels in prevention of our diabetic complication, because this might lead to crucial events in patients with COVID-19 and diabetic at the same time. So how about yung may mga matataas na cholesterol or dyslipidemia, no? So mention ko na yung pagiging hypertensive, pagiging diabetic, and this time, how about those with dyslipidemia o matataas na cholesterol? If I am suspected with COVID-19, should I still continue taking statin o yung mga pampababa ng cholesterol, just like your simvastatin, rosuvastatin, and your atorvastatin? So, actually, mayroong potential role yung statin sa COVID-19. In fact, mukhang preventive, no? Mukhang meron siyang effect, no? So statin are commonly prescribed to reduce cholesterol levels and inflammation. So this will also control your inflammatory markers and prevent complication, and it has increases your augmentation for ACE2 expression. Meron din pong protection ang statin sa thrombosis. It has an anti-thrombotic effect and may improve endothelial function in patients with COVID-19 infection. Ano pong ibig sabihin po nito? Yung mga taong may dyslipidemia o matataas ang cholesterol at nagte-take ng statin, maganda po itong gamot na to. Sabi po sa data nito, in preventing complications ng COVID-19. So ituloy lang po natin ang gamot na statin medication. Okay? Ang maganda po sa statin na to is because it's readily available, it's low cost, mura lang po, and it's proven to be safe because it's proven na wala siya masyadong complications sa kidney, sa liver, and of course because of its added effects of cardiovascular protection and lung protection. So people with COVID-19 infection who are already on statins for underlying comorbidities should continue on statin unless there is specific contraindication. So the novel use of statin in people with COVID-19 with no underlying comorbidities may be beneficial but always substantial in clinical trials. Ang ibig pong sabihin, doon po sa mga taong hindi matataas ang cholesterol, hindi po ibig sabihin na kayo ay kailangan mag-take ng statin dahil po sa sinabi ko na may protection to sa COVID. So yun lang pong may indication sa statin, just like elevated LDL and diabetic individuals na ka-statin, they should continue their statin because again, it has its beneficial effects against COVID-19 complications. Okay? So in treating our statin levels, we should risk modify our patients. So hindi po lahat ng pasyente ay pare-pareho. May mga pasyente pong that belong to low risk, moderate risk, high risk, and very high risk. Kung ikaw po ay diabetic, hypertensive, at may sakit sa kidney, you belong to the very high risk criteria. So ikaw po ay very high risk na pasyente. At pag very high risk ka, dapat mas mababa po ang control ng iyong cholesterol. In fact, according to the European Society in the Management of Dyslipidemia, kailangan po mas mababa po ang LDL levels natin to as low as 55 or less than 55 milligrams per deciliter. So these are the guidelines for those patients who belong to the very high risk category. So iba naman po sa mga pasyenteng high risk, moderate risk, at low risk. These are the example ng statin or therapy na binibigay namin sa mga pasyente. Statin, atorvastatin, rosuvastatin, simvastatin. Ito po yung mga example na binibigay namin na gamot para po sa mga pasyenteng matataas ang cholesterol. So how about if I have hypertension and diabetes? How do I maintain my cardiovascular health during this pandemic? Of course, we have to maintain good cardiovascular health. No, we have to again adhere to number one, prevention. Okay, we have to adhere to COVID-19 preventive measures. Mag-iingat, no? Kaya nga po, I think kinancel muna ng ating government yung ating pag-ease down ng restrictions sa mga protocols this March 1. Hindi pa po natin binabaan ng ating restriction. I agree with that because nga, again, we have to maintain these COVID-19 preventive measures to protect our elderly. And we have to be attentive of modifying our CV risk factors. Minention ni Dr. Oyek, aside from hypertension, diabetes, and cholesterol, we have to, again, modify our being obese, inactivity. We have to move more. No, we have to increase our physical activity. It's no longer an excuse na even walang gym, walang area. No, we could do it at the facilities of our home. We could do exercise at our home, and we could modify our diet. No, and of course, we have to maintain current medication and dosages, and we have to consult our doctors if there is need for maintenance change, or we have to upregulate our maintenance medication. Do not self-medicate, okay? Do not self-medicate. So we have to, patients presenting with new cardiovascular disease are not being diagnosed and treated in the same way, not going to the doctor ER when necessary, and that is why important ngayon ang telemedicine, no? Hindi lang po face-to-face. Both short and long-term outcomes will be affected, and thereby we have to help reduce COVID-19 transmission. Clinicians are faced with the new way of interacting patient, and that is why I've mentioned yung bago ngayon na telemedicine just to help our patients, no, to cope up with this COVID-19, especially those we have a lot of maintenance medications. So we have to address the modifiable CV risk factors, again, as mentioned by Dr. Oyek. And in summary, again, COVID-19 as a variable clinical presentation, the presence of comorbidities such as hypertension, diabetes, and dyslipidemia is associated with severe disease and even death. So sila po talaga yung delikado, sila po yung may pinakamalaking risk na mamatay dahil po sa komplikasyon ng COVID-19, and therefore we have to minimize the risk of infection. This is very critical. Prevention is still very important, and we have to maintain life-saving, guideline-directed, recommended therapy whenever possible, such as continuing our present medication and not stopping them. So with that, thank you very much. JM?
Yes, thank you very much, Doc. Ayan, so maraming salamat po. Hindi ko natanong si Doc Joseph kanina. Kamusta po puso nyo ngayon, Doc Joseph?
Ayos naman. Ito, naka-quarantine na ngayon.
As part ng
Nasa
pag-ingat ko
bahay
sa
lang.
natin,
Oo.
no? Despite na naka-quarantine o kung ano man, sobrang nagpapasalamat kami, talagang tinuloy pa rin ni Doc Joseph, no? Nakasama pa rin po natin siya. At yun nga, ang nakuha ko na medyo importante dun sa mga nakuha pa ni Doc Joseph, kung kanina si Doc Jen diniscuss na paano yung prevention ng pagkakaroon ng cardiovascular disease in general. Si Doc Joseph naman, paano kung meron ng sakit sa puso? No? Paano kung meron ng sakit sa puso at kung sakali may kondisyon na may hypertension, may diabetes, o kaya mataas ang cholesterol, dapat bang itigil o ayun nga po, o pagpatuloy yung gamot na binigay sa kanya? So as a general rule, syempre, do not self-medicate. Kailangan natin ng advice ng ating mga doktor kung sakali po na anong dapat gawin tungkol dun sa gamot na iniinom. At yun din po, yung prevention na magkaroon ng COVID at saka po yung mga modifiable natin na mga risk factors. So again, mamaya po after po ng ating discussion po for our third na topic po, andyan si Doc Joseph para sagutin yung ating mga katanungan. Thank you very much, Doc. You are the best. Thank you, Doc. Thank you. And now po, as a icebreaker lang habang hinahanda natin yung ating third na topic, ay ipakita lang natin, Ma'am Lichelle, kung sino ang makaka-receive ng ating mga IEC materials, yung ating mga freebies natin. So from the list po ng ating mga participants, yung mga naka-attend sa Zoom now, we are doing this spin para malaman kung sino ba ang mananalo ng ating ballpen. Yung ating kumusta ka ballpen. Ayan, kumusta ka ballpen. Ayan, screenshot po siya later na kung sino ang dapat manalo ng ating ballpen. Sige ma'am, para sa ating unang winner. Ayan, siguro pumapasok na yung ating spin the wheel, pero hindi pa namin nakikita, Ma'am Michelle. Ayan, siguro papasok na siya. Hindi pa rin. Ayan, nakikita na namin, Ma'am. Sige po, sino ang ating unang winner? Mag-a-appear sa screen. Congratulations! Sir John Norman Ditan. Kayo po ay nanalo ng Kumusta Ka Pen. Para naman sa ating winner ng Kumusta Ka Mag. Ayan, so Sir John, pa-screenshot na lang daw. Ganun daw yata pag nagla-live selling. Po. Next, Ma'am Lichelle, para sa ating susunod na winner. Mananalo ng ating Kumusta Ka Mag. Congratulations to Doc Cherry May Tan. Wow, congratulations po, Doc. Kayo po ay nanalo ng Kumusta Ka Mag? Pa-screenshot na lang daw po. 5, 4, 3, 2, 1. At para naman sa ating Health Journal, makakatanggap ng Health Journal. Yan. Ang mananalo ng ating Health Journal ay walang iba kundi si... Again po, nanggaling yan dun sa ating sa ating mga participants. Ma'am Abigail Joy Pido, congratulations po. At later po malalaman niyo kung paano makukuha ang ating mga premyo. Yay daw, sabi ni Doc Cherry. Yes po, congratulations. Ito para kay Ma'am Abigail. Thank you. At ngayon, para naman po magpatuloy tayo para sa ating susunod na topic. Ayan po. So, i-welcome po natin sa ating virtual floor, ang ating mga speakers para sa ating pangatlong topic. Ayan po. So, welcome po natin Dr. Alma Cristina Andin Salcedo, our cardiologist, medical specialist 2, and Dr. Kenneth Christopherson Europa, our psychiatrist naman po, from the outpatient section. Ayan, Doc Shi.
Hello, good afternoon po. Let me just fix the slides lang po ha.
It's okay, Doc. Kumusta naman ang puso natin, Doc Shi?
Masayang-masaya po. Masayang-masaya po ang aking puso ngayon.
Amen. Ayan. Si Doc Kenneth ba pwede rin kumustahin natin habang naanda lang ni Doc si yung presentation?
Oh,
Doc Kenneth.
okay naman. Oh, ayos na ayos yung puso ko, walang problema.
Ayun. Kasi kung sakali, ayun, mag-usap na lang kayo, Doc.
Yes, there. Can you see my slides now?
Yes, Doc. Nakikita po namin ng slides at naririnig din po namin kayo ng maayos. Thank you, Doc. Take it away.
Okay. Magandang hapon, tanghali po sa inyong lahat hapon. Ako po si Dr. Alma Cristina Andin Salcedo, and I am very fortunate enough to invite Dr. Kenneth Europa, a very good friend of mine, my batchmate in FEU. So ngayon po, just to give you a background, ang aming topic ngayon is entitled Love Your Mind and Mind Your Heart. To tell you frankly, Dr. Kenneth, this is a very, very challenging topic for me. Kasi even in my fellowship years sa Philippine Heart Center, this is one of the topics na hindi namin masyado na-discuss, the link of depression and coronary artery disease. So Dr. Kenneth, I will be moderating our lecture and I will call you kapag hihingi na po ako ng tulong. Okay po?
Okay, sige, wala problema.
Okay. Okay, let's start. Let me start with a very good quotation from the World Health Organization. No, I am sorry. Parang hindi ko nababasa. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Mental health is an integral part of this definition. In 1990s po, the World Health Organization has tried to predict what will be the number one causes of debilitation after 30 years. Ang sabi po sa WHO, by the year 2020, which is just last year, both coronary artery disease and depression will be the two major causes of disability-adjusted life years. So, we are here. Now, question, is it true? Yes, it is true. And lumalabas na po sa ating mga statistics na the coronary artery disease has persistently been the number one killer, and depression also has been the number one cause of disability. This is a discussion that has been stressed parati po, even kapag kami po ay gumagawa ng discussion for laymen, ito pong lagi naming sinasabi, cardiovascular disease, or pag sinabi ho natin cardiovascular disease, these are group of disorders involving the heart and the blood vessels. So pag sinabi natin cardiovascular disease, I'm talking about heart disease o sakit sa puso and stroke, o yung atake sa brain attack na tinatawag. So these are the numbers, and I'm sure Dr. Oyek and Dr. Quaresma has stressed this enough. Pero question, Dr. Kenneth Europa, nung pumasok ang pandemic, do you think that heart disease is still the number one cause of death in the world?
Ay, nung pumasok naman yung pandemic, Doktora, nandiyan pa rin naman yung heart disease, pero mas dumami na lang lately yung nagkaroon ng mga adjustment problems, yung mga nagkaroon ng anxiety and depression dahil na-contain yung tao sa isang lugar, na-isolate. Kumbaga yung normal na ginagawa natin dati, biglang naputol, and lahat tayo hindi alam paano gagawin. So nakadagdag pa ito sa mga risk factors sa mga taong may heart problem din.
That's right. So actually, this is very interesting kasi hinanap ko rin to, no? Kasi sa sobrang dami at ang number one na sinasabi sa report is COVID, cause of death, 1 million, reaching 1 million and everything. But that is true. At one point in time in 2020, COVID-19 has actually exceeded the number of deaths sa coronary heart disease in terms of the final diagnosis. You can see at the point ng April 18 to 25, mas nataas niya ang heart disease. So, ang question, heart disease tayo ng heart disease, ang mas pumapatay ngayon, COVID. Now, the problem is, there is also an impact of COVID-19 procedures, diagnosis, and treatment sa heart disease. Do you know that 64% ang hindi nagawang procedure last year to diagnose heart disease, and almost 700,000 ang diagnostic procedures ang hindi na-perform? And according to the CDC, I'm not sure kung kasama ang Southeast Asian dito, but even the most, the first world countries, 65% of patients has avoided checkups because of the pandemic. So the impact of this is, hindi kasi natin nakita kung anong nangyayari sa mga pasyenteng may heart disease. And Dr. Quaresma has already discussed these facts that deaths from heart disease and stroke has increased during the pandemic, and people with serious heart conditions at higher risk from severe illness of COVID-19. So yung mga namatay ng COVID-19, inatake din actually sa puso at na stroke. And cardiovascular disease was still the most common underlying condition associated with COVID-19 deaths. So to adjust this, masasabi natin na tingin ko, it's still cardiovascular disease ang pinaka number 1 killer despite the pandemic. So next slide. I will just reiterate yung mga na-discuss kanina. So in layman, what is coronary artery disease? I have this illustration here. Ang coronary artery disease or CAD is actually the narrowing of the coronary arteries that supply the oxygen to the heart. Alam natin to, being doctors, nurses, and even patients, kasi I'm sure all of the doctors, when they discuss about coronary artery disease, na discuss to. And when we talk about heart attack, this is actually the consequence of coronary artery disease. This happens when the heart's blood supply is suddenly cut off, biglang bumara, or natanggal yung plaque na nakikita natin dyan at biglang bumara sa mga distal parts of the arteries. Yun ho ang tinatawag na heart attack. Kapag nangyari sa brain, this is stroke. So ito yung question na nakakatawa man isipin, even as cardiologists, despite effective guidelines, advances in cardiovascular therapy, why is coronary vascular disease still the number 1 killer? Kasi alam natin, actually, sa totoo lang, in 100 years of cardiovascular therapy, I think ang heart treatment is actually reaching its peak. I mean, we have ICDs, we have bypass, we have PPIs, we have heart transplant. Nandoon na tayo sa treatment. Pero looking back, bakit pa rin siya number 1 despite these guidelines and treatments that we have? Ito po yung na-discuss na. I think what we have to do is to look back. Ano ba ang nagkakos ng coronary artery disease in the first place? Ito po yung na-discuss ni Dr. Quaresma at ni Dr. Oyek. We have the traditional atherosclerotic cardiovascular disease risk factors, yung diabetes, smoking, obesity, overweight, physical inactivity, hypertension, dyslipidemia, and actually because these are the most common risk factors, dito po umiikot ang aming guidelines. So ito po ang mga ginagawa ng Philippine Heart Association, ng American College of Cardiology, and the European College of Cardiology na pinagbabatayan naming mga cardiologists to reduce yung mga hard endpoints ng coronary artery disease. But actually, hindi lang po yan ang mga risk factors. There are emerging non-traditional risk factors that we still do not know and understudied. Actually, these are studied, pero yung mga studies na lumalabas is yung correlation hindi pa po significant, pero by incidence, sa mga pasyenteng nagkakaroon, mataas ang association. Karamihan dyan is yung mga sa babae, katulad ng preterm delivery can actually cause atherosclerotic cardiovascular disease pa, hypertensive disorders of pregnancies, diabetes in pregnancy, autoimmune diseases sa mga rheumatologists, most common to na mga tinitreat nila, breast cancer sa mga cancer, and of course, depression. At dyan po tayo magtututok ngayon, depression. So depression, Dr. Europa, I will give you the floor to discuss about depression. You just tell me if you want for me to move the slides.
Okay, sige. Good afternoon. I'm Dr. Europa. Hello? Sige.
Yes, doctor, I can hear you.
Next slide. Next slide na.
Okay.
Okay, ito, depression yung una, yung depression and yung bago yung slide na yan.
Okay. Depression and yung correlation, doctor, ito po yung mga slides. Is that it? Okay.
Okay. Ayan. Ano ba yung relationship ng heart problem with depression? According din sa mga studies kasi, depressed individuals have a 64% chance na magkaroon ng mga coronary heart problem. And accordingly, bakit sila nagkakaroon ng heart problem yung mga taong may depressed? Una-una, yung depression itself kasi, hindi lang naman yung brain ang na-affect nito. Other parts din ng katawan natin na i-infect niya, nagkakaroon ng low-grade inflammation. Kaya dahil nagkakaroon ng low-grade inflammation, nagkakaroon ng bara sa mga arteries, which increase the risk for coronary artery disease. Pangalawa, ang mga taong depressed ay nagpo-produce yan ng madaming stress hormones. And ang stress hormones, isa ito sa mga hormones na nagpapabagal ng pagkilos ng mga arteries natin. Kaya prone sila. Tapos yung kanina, sinabi nila Dr. Oyek, Dr. Quaresma, and Dr. Salcedo, di ba? Ano ba yung mga traditional risk factors for heart disease? Ang mga taong depressed ay meron nun. Di ba? Hindi sila masyadong kumakain or kain sila ng kain, physical inactivity, kulang sa tulog, kaya mas tumataas yung risk nila to have depression. So there's a link talaga between the two. And accordingly pa nga daw yung mga taong may coronary artery disease, tapos nagkaroon ng depression, may mga 59% chance na mas malala yung magiging result ng kanilang heart problem. So dapat it goes hand in hand. Maliban dyan, kasi yung chances na may depression ng isang tao, malaki ang chance na may comorbid na anxiety siya. Next slide.
This one?
Sige, next pa. Sabi naman na natin yun.
Yes. Actually, doctor, yan lang yung this one.
Yung kanina, ganyan lang naman yan. No? So, may link naman na talaga. Although ang sinasabi rin, pwedeng independent risk factor yung depression, pwede rin makadagdag yung depression sa factor ng heart problem. And accordingly, may mga bagong studies na ito yung mga emerging new risk factors to develop coronary artery disease ay mga stress and depression. Next slide.
Okay. Dr. Europa, I will just can I ask you, Dr. Europa, regarding some of background para sa mga non-psychiatrist nating mga patients, what is the prevalence of depression ngayon sa ating mga middle-aged group, even sa ating mga nag-work? And how can you see that they have depression already? Ano yung mga risk factors nila?
Siyempre, first and foremost kasi, according din sa NIH dati, according sa statistics, ang number one naman talaga na mental health problem sa Pilipinas is anxiety. Anxiety ang number one, tapos ang depression. Ano ba yung mga risk factors for having a depression? Marami, multifactorial naman kasi yan eh. Una-una, tingnan mo yung biological perspective. Baka may family history na mayroong ding may depressed family members. Pero it doesn't mean na pag may kapamilya kang may depression, magiging depressed ka kaagad. Risk factor lang siya. Pangalawa, ano ba yung psychological factor? Paano ba lumaki ang isang tao, isang individual? Tapos kailangan din natin ma-delineate yung clinical depression from malungkot lang. Kasi karamihan ngayon, makikita mo, parang may problem lang, depressed na ako. Pero hindi, sad ka lang. Ano ba yung nag-delineate between the two? Pag sinabi mo clinical depression, yung functionality mo impaired na. Hindi ka na nakakapagtrabaho, hindi ka na nakakaligo, hindi ka salamuha sa ibang tao. Tapos persistent siya eh. Meaning dapat 2 weeks or more na meron ka ng sintomas, hindi yung fleeting lang. Iwan ako ng boyfriend ko, depressed na ako. Hindi ganon. So dapat nadidelineate din natin yun. And bilang nagtatrabaho tayo sa National Center for Mental Health, tayo mismo mga mental health workers, ang nagsasabi nito o nagbibigay ng awareness sa mga tao na pag malungkot ka, hindi pwede sabihin na depressed ka kaagad, baka malungkot ka lang. Or baka malungkot ka, nahihirapan ka lang mag-cope. Yun lang. Thank you.
Okay. So, si Dr. Europa has explained the relationship of depression and coronary artery disease. Actually, naunahan ako ni Dr. Europa. Dapat sisimulan ko siya na there are two facts that we know and all of the studies po ay napakita to. The two facts are coronary artery disease can cause major depressive disorder. When we say major depressive disorder, am I right? This is already a clinical diagnosis of actual depression, hindi yung sad lang. And likewise,
Yes, tama.
depression itself is an independent risk factor for CAD. So, just to refresh the statistics sa sinabi ni Dr. Europa, I have this statistics sa mga pasyente na merong coronary artery disease na diagnosis o nakitaan na silang may bara sa puso, 17 to 44% are actually diagnosed of major depressive disorder. So this is a significant number. Sa mga pasyente naman na inatake na sa puso, almost 19 to 66% ang may mental disorder pero hindi lang usually actually depressed yon. These are primarily they are depressed patients and also anxious patients. Yun yung mga nakikita sa mga inatake na sa puso. And those who will undergo bypass surgery o yung tinatawag nating CABG, ito po yung surgery sa mga pasyenteng may bara sa puso na nagkakaroon na ng malfunction ng heart kaya kailangan gawin yung surgery. 27% of the patient are actually develop depression. So next slide. So like Dr. Europa, in-explain niya kanina, what are the risk factors for a patient to develop depression? So the question remains differently. Ano naman yung mga risk factors ng pag-develop ng depressed patients na merong heart disease? Let me reiterate that. What are the risk factors for depression in cardiac patients? So sino ba ang nagiging depressed sa mga may problema sa puso? Sa mga pasyenteng may coronary vascular disease, nakikita na actually these are younger patients. As you can see, sa mga traditional risk factors natin, sabi, older patients are more at risk. Pero in developing depression in heart patients, younger patients and women are the more at risk than the other group. Di ba sabi do sa coronary artery disease, males and elderly. Pero sa depression, younger patients and women. Sa mga patients naman na may coronary artery disease, these are usually sa mga nag-atake na sa puso or acute coronary syndrome. Ang mga usual na nagde-develop ng depression ay yung mga may poor functional status kasi usually kapag tayo ay inatake na sa puso, yung New York Heart Association severity o kaya ito yung ang functional capacity mo after you had heart attack, pag mas mahina ang puso, mas konti ang nagagawa nila. So these are patients who are actually becoming more depressed. Diabetes patient who are socially isolated, sa mga pasyenteng who will undergo surgery and implantation of a mechanical device, ito yung mga younger patient and those who are living alone and less educated. Na-explain na ni Dr. Europa how depression causes coronary artery disease. In short, he has explained the inflammation as a cause of cardiovascular risk factors. Also, he has explained yung mga hormones and yung mga behavioral mechanisms that causes cardiovascular disease. In yung cardiovascular disease, likewise, yung mga pasyenteng may heart disease, they develop depression because these are the patient na meron silang feeling na they have perceived loss sa kanilang pang-araw-araw na buhay. So kapag inatake o may sakit sa puso, they lose their feeling of immortality or invincibility. Hindi sila yung mga nagiging dependent na to other family members, even yung financial and employment security nila, and even sexual relationship decreases. Because of this, they develop depression also. So these are the facts to just summarize. Depression is an independent risk factor of CAD, not traditional, but still independent. Depression worsens prognosis of patients with coronary artery disease and complications. Number 3, depression increases risk of sudden cardiac death, and depression increases the all-cause cardiac mortality. So let me reiterate that again na mas naiintindihan ng mga non-medical group. Ang depression ho ay pwedeng mag-cause ng sakit sa puso or in actuality coronary artery disease. Sa mga pasyente naman na meron ng coronary artery disease, kapag ang mga pasyenteng ito ay nagkaroon ng depression, mas nagiging worse ang outcome nila and mas possible na sila yung mga nagde-develop ng cardiac events like stroke and myocardial infarction or heart attack. Number 3, depression increases the risk of sudden cardiac death. Ibig sabihin, merong mga nakitang studies na ang depression nagkakos ng biglang pagkamatay because of cardiac problem. Number 4, yung cardiac mortality, yung mga cause niya, isa ang depression sa mga nagpapataas nun. So this has been explained already. So ngayon, I just want to reiterate for those who are gustong malaman kung bakit napunta tayo sa studies. Ano ang mga studies na nagsasabi na ang depression is an independent risk factor? I have to prove this kasi nga, kahit na sa mga major societies, hindi ito well discussed. So this is a very, very busy slide. When you see this slide na yung may red and alternating red and orange color, these are sample researches that shows association of major depressive disorders and coronary artery disease. Sa totoo lang, hindi po lahat yan. There are total of 47 studies already. Kung titignan nyo sa right side, ito ay isa pang table showing yung yung association ng mga studies na to. In all 47 studies, pag ini-evaluate po kasi natin ang studies or mga researches, we actually check whether good, fair, or insufficient yung mga criteria for us to say na ang isang research is significant or we can take such association into clinical practice. So sabi, the strength of association, prediction, consistency, and dose response of depression and heart disease are good. When we say strength of association, ibig sabihin nun, sa strength of association, ilan ba ang studies na nagpapakita ng association ng depression and heart disease? And gaano ba katagal pinag-aralan ito? There are 47 studies who shows positive association and yung acceptable timeline nila na pinakita is actually from 4 to 40 years. So maganda daw ang pinapredict nito. When we say prediction, does depression and does depression predict na magkakaroon ka ng coronary artery disease? And is it statistically significant? Ibig sabihin, halos lahat ng mga studies na yon pinakita na may prediction ho yun. When we say consistency, pare-pareho ba ang pinapakita ng research? Pare-pareho ba ang mga tao na pinasok sa research at saka yung mga gamot na ginamit sa research? Pare-pareho ho, halos lahat. When we say dose-response effect, kung mas malala ba ang depression, mas mataas ang possibility na tayo nagkakaroon ng coronary artery disease. Also good. So in terms of specificity and biological plus possibility, positive pa rin ang pinapakita ng research natin. When we say specificity, ang depression ba mas nagko-correlate strongly to development of coronary artery disease than the other. Kaya lang siya fair kasi anxiety also causes that. There are also psychological risk factors na hindi pa rin masyadong napapag-aralan that cause association. When we say biological plausibility, ano ang mga hypothesis to explain? So medyo hindi lang pare-pareho ang explanation doon, pero still correlating to that, kaya fair. However, this is what I want to stress out. Yung response to treatment. Kaya hindi ito masyadong napapansin because of this factor. When we say response to treatment, kapag trinit mo ba ang depression, matitreat mo ba ang coronary artery disease progression? So yun ang insufficient. It doesn't say na hindi, ang sinasabi lang, hindi lahat at only moderate ang mga studies such as two of the most important studies, yung Enrich and Impact trial. They have modest positive na sinasabing pwedeng makapag-treat pero hindi kasi siya statistically significant. Next slide. So the question for most of the patient, ito po yung mga tanong na pwedeng itanong ng mga pasyente sa ating mga internists or even general physicians and cardiologists. In patients with depression without clinical heart disease, will treatment of depression reduce the risk of cardiovascular events? And number 2, in patients with depression with baseline heart disease, will treatment of depression reduce the risk of cardiovascular events? Again, sa mga pasyente ba na may depression na walang sakit sa puso, kapag trinit mo ba ang depression, mare-reduce mo ba ang possibility na magkaroon ka ng problema sa puso? And number 2, kapag ang pasyente ay may sakit na sa puso na, pag trinit mo ba ang depression, will treatment of depression reduce the risk of cardiovascular events? And to answer this, there is actually a very, very nice research that I've seen done in 2014. This is a randomized controlled trial or the impact randomized controlled trial. Ang ginawa po dito sa studies na to, tinignan nila ang mga depressed patients and they divided the patients into those without clinical heart disease and those with heart disease. Tapos, ang ginawa po nila sa mga ito, nagbigay po sila ng treatment. Ang ginawa po nila, nagbigay sila ng treatment doon sa trinit nila yung depression doon at tinignan nila kung nagkakaroon ng improvement sa heart endpoints. So the result is this one. Kapag trinit nyo daw ang depression sa mga pasyenteng walang cardiovascular disease, nakaka-reduce siya actually ng events. Actually, when we talk about events, we are talking about heart attack and stroke. Yun po. And number 2, sa mga depressed patients without cardiovascular disease, who receive collaborative care for depression. When we say collaborative care for depression, ito po yung nag-receive both pharmacological treatment and cognitive behavior treatment. Mas maganda pa ang pag-lower ng risk niya sa usual care ng patient. Ibig sabihin, ito yung mga pharmacological treatment siya. Pero as you can see, 48% and 19% are still significant. However, dun sa mga pasyenteng trinit ng depression pero meron ng cardiovascular disease, comparable lang. So it means it's not significant. But pag trinit natin ng depression, evidence-based depression treatment, yung mga kailangan na mga gamot at yung mga therapy, meron pa rin meaningful reduction in incident CVD events. When we say about incident, it's not statistically significant, pero marami pa ring pasyente ang nag-improve ang quality of life. Next. So, ang question ngayon, how do we screen depression in at-risk patients for coronary artery disease? Ang mahirap po kasi ni Jan, if we are in the hospital, in the clinics, at may mga pasyentes, aminin na po nating mga general physicians, sometimes we do not have time or the screening material for us to detect sino ba ang at risk for sino ba ang mga depressed dito. But recently, the American Heart Association, and actually hindi ko lang muna lagay the European Heart Association or the European Society of Cardiology, has recommended routine screening to improve the detection of depression sa mga patients with CAD. This is the Patient Health Questionnaire or PHQ-2 and 9. So what is this? Ang maganda po dito, madali lang, 2 tanong lang ho, very ultra short screening, good sensitivity, good specificity in adults and adolescents. Ang tatanong lang ho natin dyan, number 1, do you have little interest or pleasure in doing things? Siyempre, use it in your own vernaculars. And number 2, are you feeling down, depressed, or hopeless? Kapag nagkaroon ho sila ng answer dyan, sa akin, kahit kahit several days lang yung sinasabi, it's important for us to proceed to another training. Ito yung PHQ-9. Mas mahaba po ito. These are the questions that we will ask. And baba, as you can see, merong interpretation. If we see that there is depression severity, this is the time that it's important for us to refer this to psychiatrists for further evaluation. Because they say that the only test that actually will diagnose or confirm depression is the DSM criteria. Dr. Europa, can you comment on this? On how you actually derive depressive disorder as a diagnosis?
When we diagnose depression, we will base it on the DSM. It's already DSM-5. DSM-5 criteria. No?
Yes, sir.
Marami siyang letters, pero most of the time, 4 lang naman ang major na tatandaan mo dyan. Una-una yung letter A, duration. Gano'n siya katagal? For a severe depression, dapat 2 weeks or more na everyday yung mga symptoms. Pangalawang criteria niyan, yung mga symptoms, there are 9 symptoms. then you need at least 5 out of the 9. Ano ba yung mga 9 symptoms na yan? Una, dapat meron siyang depressed mood. Pag sinabi mong depressed mood, subjective or objective to. Sinasabi niya, napapansin ng iba, napapansin na malulungkutin siya. Sinasabi niya malulungkutin siya. Tapos dapat araw-araw to. Pangalawa, yung little interest, yung anhedonia. Dating mahilig magbasa, dating mahilig magbike, biglang natitigil na, ayaw na. Pangatlo, tulog ng tulog o hindi makatulog. Pang-apat, kain ng kain o hindi makakain. Pang-lima, may aligaga o kaya nakatulala. Pang-anim dyan, feeling niya wala na siyang kwenta, wala nang saysa yung buhay niya. Pang-pito, wala siyang energy. Pang-walo, hindi na makapag-concentrate, hindi na makapag-decide. Pang-siya, may mga recurrent thoughts of death or mga suicidal ideation. Kailangan mo lang doon 5 out of the 9. So, criteria A, duration, 2 weeks. Criteria B, symptoms, 5 out of 9. Yung criteria C niyan, dapat yung functionality niya impaired, meaning hindi na nakakaligo, hindi na nakikisalamuha. Tapos yung last niyan is dapat na-exclude mo. Baka mamaya, yung depression niya ay dahil meron siyang general medical condition or baka mamaya meron siyang substance use. So that's how you come up with a diagnosis. Yung mga screening tool, most of the time, it can help as baseline for the treatment and management of the patient. So, clinical pa rin, aside from the DSM-5, yung history pa rin ng patient, aalamin mo ano yung history niya prior na magkaroon siya ng depression. Yun lang. Thank you.
Thank you, Dr. Europa. So let us proceed. So the question now is, hindi to kasama sa pero yung sa amin, sa coronary artery disease, na-explain na yan ni Dr. Quaresma. But now, we're going to discuss ano ba ang mga important na malaman dito sa mga medications, psychiatrist medications in patients with coronary artery disease. We actually divided this into what are the first line. Number 2, what are those medications which are safe for heart patients. Number 3, which are the medications that you should use cautiously sa mga merong heart problem. And number 4, which of the medication na kailangan hindi mo dapat gamitin sa mga heart patients. So here, this slide shows that sertraline or citalopram plus clinical management. When we talk about clinical management, I'm talking about the therapy, the cognitive behavior therapy, and other therapy. These medications are the first line of treatment for patients with coronary artery disease. Dr. Europa, ang mga ito ba ay available sa atin sa NCMH? This sertraline?
Yes. Dr. Hello, Dr. Andy.
Ay, yes, I can hear you po.
Yes. Available yan sa National Center for Mental Health, yung mga SSRI, especially yung sertraline, citalopram, fluoxetine, and paroxetine. Meron tayo niya sa pharmacy, so we can give that medication.
So so ang makakatulong sa atin kapag may heart patients tayo sa mga ating mga doktor sa PAV7, if we see that the patient has high likelihood of coronary artery disease, tingnan ho natin yung mga gamot kasi kapag yung mga gamot na to, it may interact with other medications or it can worsen the problems, the heart problems sa patient. So in general, sertraline or citalopram is the first line. Now, there are times when these medications are not enough. So what are the other medications that are considered safe? So I'm sorry, I'm not very familiar with these medications, but to show you, these medications, the trazodone, venlafaxine, the mirtazapine, bupropion, and duloxetine, they have effects in blood pressure and heart rates, but they are still considered safe. We can still start this. We just have to monitor the blood pressure and heart rates of the patient, and also to reduce the dosage ng mga medication which can enhance the effects, the bad effects. For example, yung mga increased blood pressure, kapag ginamit natin itong gamot na to and we see that it can increase blood pressure, we just have to adjust the antihypertensive medication of the patient. If we see that this can cause tachycardia, we just have to start the patient on beta blocker or something like that. So next is what are the medications that should be used in extreme caution? So these are the tricyclic antidepressants. Kasi ito yung mga nagkakos ng mga tachyarrhythmia such as sinus tachycardia, and worst is ventricular fibrillation from that range. So kung kailangan talagang gamitin na ito, we have to evaluate the patient muna and mag-start muna at low dose probably. If at a low dose, nakita natin na meron na kahit hindi pa nakukuha ang effect ng gusto nating antidepressant, baka kailangang palitan. And there are other therapies that is pwede po sa pasyente. And MAO inhibitor, sabi nga ni Dr. Europa, this is not used anymore. Tama ba, Doc Kenneth? Wag po natin gamitin to sa mga pasyenteng may
Yes, tama, Doktora.
hindi na ginagamit to. So, behavioral interventions, available po to sa NCMH, Dr. Europa, tama po?
Yes, yung mga psychotherapy for the patients with depression. And syempre, hindi lahat ng patients ay pwedeng i-undergo ng psychotherapy. Kasi iba-iba naman yan. Baka yung iba, kailangan lang yung mga mas milder form like supportive psychotherapy or psychoeducation. O yung iba, baka kailangan mong i-CBT. May mga other forms. And yung mga residents natin dito are trained to do such behavioral treatments. Thank you.
Okay. So, of course, in our side, we have the cardiac rehabilitation. Usually, cardiac rehabilitation, we prescribe this to patients who underwent surgery or to patients who had heart attack. So, it is composed of different aspects: the pharmacological therapy, smoking cessation, exercise, diet, education, and behavior. And it is seen that cardiac rehabilitation reduces the risk of cardiac mortality and all-cause mortality. And of course, it promotes general health and well-being. So it improves the quality of life and psychological well-being of the patient. And it improves the ability of the patient to deal with stress, anxiety, and also depression. So in conclusion, in our report, let me do this, Dr. Europa na lang, depression is associated with increased cardiac risk. And post-MI patient or those with heart attack have symptoms of depression. Recurrent depression worsens cardiac outcomes. Cognitive behavioral therapy improves mood, but not improve the cardiovascular outcomes of cardiac patients. But sometimes, of course, if that is what we have, if that will improve the quality of the of life of the patient, we still do it and we still recommend it. SSRIs improves mood and appears to be safe in cardiac patients, and treatment of depression leads to better clinical outcomes. Let me end with this. A good physician treats the disease, but a great physician treats the patient who has the disease. And that, thank you for your attention.
Yes, Doc. Thank you, Salcedo. Thank you, Dr. Salcedo and Dr. Europa, for your discussion. Sobrang, yung topic po na ito related, syempre, dun sa ating mga nurses, syempre, ating mga doctors po na nag-aalaga ng mga patient o sa mga person po na mayroong depression, syempre na dapat hindi lang natin nakatutok dun sa kanilang sabihin natin mental condition, mental health condition, but as well, syempre tingnan din natin yung condition ng kanilang mga puso. And syempre, para naman sa pangkalahatan, importante ito kasi yung nagiging epekto, nung mga mood natin sa pagkakaroon, sabihin natin as a risk factor sa pagkakaroon ng coronary artery disease. Okay. So at this point po, I ask po yung ating mga resource speakers to become available and ready po para sa ating question and answer. So again, binubuksan ko po ang ating chat box para doon sa ating mga question sa ating mga participants na nandito sa ating Zoom. And then ngayon nakatutok na din ako dito sa ating Facebook Live para po doon sa inyong mga katanungan. Okay? So, ayan, sige po, wag na po kayong mahiya. Samantalahin natin yung pagkakataon na makapagtanong po sa kanila. Ayan. Pwedeng magtanong ng kahit ano mo, kahit ano. Kahit anong muna. Kumustahin natin sila, kumustahin po namin kayo. Ayan. Baka gusto nila may premyo din yung magtatanong, no?
Ako na lang magtatanong.
Yes, Doc. Sige po. It's a, ano naman.
Tanong ko kay Kenneth siguro. No? Kasi I think, Kenneth, ano ba yung sa experience mo yung most common or mga drug-to-drug interaction? No? Problem kasi is may mga drugs ng cardiac, no, that can interact with medicine sa depression. Could you tell us your experience or probably theoretic?
Doc, mostly lang naman pag yung mga depression with psychosis, as much as possible, yung mga antipsychotic na iniiwasan na may probable na cardiac effect, yung mga quetiapine o lansapine, yung mga atypical antipsychotics. Pero with the antidepressants, most probably naman safe po karamihan po dyan, Doc. Tapos ang isa pa pong pinakamaganda rin, Doc, especially for the elderly patients, may mga heart problems, mirtazapine po. Yung Maui, most probably.
Thank you, Dr. Philip. So, syempre po, since this talakayan, talagang pwede po nating ibato din, even yung ating mga speakers, na po dun sa iba nating mga speaker, dahil sa gusto natin na mas stimulate pa tayo dun sa mga maaring mga questions o mga clarifications pa na maaring hindi na-discuss natin kanina habang nagbibigay po ng talk ang ating mga speakers. Okay, so sino pa po? Sino pa yung mga gustong o sino pa yung may mga tanong? I'm sure naman dito pa sila. No? We still have 72 participants dito sa ating Zoom meeting and we have 23 participants going 28 sa ating Facebook Live. Okay, kasi dalawa lang naman yan talaga. Siyempre, kung wala pang masyadong tanong, maaaring sobrang naintindihan siyempre sa the way na diniscuss ng ating mga speakers ang ating mga topic. So, siyempre nga, yung huling na-discuss nila Dr. Salcedo tsaka ni Dr. Europa, na yung connection ng pagkakaroon ng depression as an independent risk factor for coronary artery disease. And then, yun namang may mga sakit sa puso, yung coronary artery disease na pwedeng later po magkaroon ng depression. Okay? Sino pa? Kasi baka ang mahatid talaga dito si Dr. Europa kasi magtatanong sila Dr. Quaresma, Dr. Joseph, Dr. Salcedo pa sa Doc Jen kay Dr. Europa. Anyways, yun naman talaga yung purpose ng ating discussion boy. Ng ating platform kaya meron tayong cardiologist and meron tayong psychiatrist. Yes po. So sino pa ang gusto magtanong? Or kung nahihiya po kayo, na gamitin yung ating Zoom room meeting, you can also provide me yung question na privately, and hindi ko babanggitin kung sino yung nagtanong. Ayan, meron ba? Meron na ba sa ating chat box kung sino po? Ayan, kasi kung wala po, ako na yung magtatanong. Ayan, may recitation. Siguro as part ng habang hinihintay natin na mag-respond sila o magbigay pa ng tanong po, ang iiwanan kong tanong para po sa mananalo ng another 100 pesos na load. Ito naman, para sa another 100 pesos na load is, yung tanong natin doon is, ayan. Ano ang relasyon ng coronary artery disease sa depression? At kabaliktaran niya, ano ang relasyon ng depression sa coronary artery disease? Kung sino yung makapagbibigay ng magandang paliwanag, ayan, ay mananalo ng 100 pesos na load. Ayan. Meron na po ako dito sa aking chat box. Ayan. So, ang tanong po, kung yung family ko ay may coronary artery disease, may risk po ba na magkaroon din ako? So, ang tanong niya is as a family history. Ano po? So sino po sa mga speaker natin ang pwedeng sumagot? Siguro si Doc Zen. Ayan, si Doc Zen. Naka-mute lang po si Doc Zen.
Hello. Sorry. Good afternoon. If yung family mo or yung father, mother mo maagang nag-heart attack or nag-stroke, mas mataas talaga yung risk mo na magkaroon ka rin ng coronary artery disease or magkaroon ka ng stroke. So, kunwari mataas yung cholesterol nila, mas mataas din yung chance na mas earlier, tataas din yung cholesterol mo. So, mataas talaga yung family predisposition ng mga risk factor. Kahit mga diabetes, stroke, heart attack, kung sa family nagra-run na earlier age, nag-heart attack na sila, nag-stroke na sila, mas mataas yung risk mo na magkaroon din ng ganun at an earlier stage.
Okay. So mali na po yung sinabi ni Doc Zen, no? So talagang kapag ka meron sa pamilya, because yung mga risk factors nga natin, may kinalaman din po talaga sa family history, mas mataas din ang chance na magkaroon ng coronary artery disease. Salamat po sa question. At salamat din po kay Doc Jen sa pagbibigay po ng sagot sa ating tanong. Okay, sino pa po? Again, samantalahin po natin yung pagkakataon. Although alam ko naman po na, ayan, meron na. Medyo Tingnan ko sino makakasagot dun sa ating mga speakers. Sabi po, how long can you live with coronary artery disease? So kung sakaling nagkaroon po ng coronary artery disease, ayan, how long can you live daw po? Mala prophet ba to? Yes, mukhang si Dr. Sacedo.
Actually, hindi yung pag may coronary artery disease po kasi tayo, it will depend on the severity. And usually, nakikita ho natin yung severity, depende ho sa number 1, objective findings, and number 2, subjective findings. When you say objective findings, gaano ba kahina yung puso mo to start with? Functional class ba? Ano po ba ang functional class mo? When we say 1 kasi, ito yung mga no symptoms. When you say 4, konting galaw mo lang, hindi ka na nahihirapan ka ng huminga, yun po yung mga ibig sabihin. No? Number 2, ano po ba yung lakas ng puso? In general, the worse your functional capacity, the shorter it is. Unfortunately, I cannot really give you a time kung meron, but we have to note that ang ventricular tachycardia kasi, yung mga tinatawag nating major arrhythmias, which can be seen in coronary artery disease, especially mga pasyente hong na inaatake na ho sa puso. It can happen at any point in time with or without medications. So, ibig sabihin, mas mataas ang possibility ng mga pasyente na may poor functional capacity and very, very low ejection fraction, yung lakas ng puso, than those with a better functional capacity. The shortest is, what I've seen is, upon diagnosis, sa mga may poor functional capacity, 6 months is long already, kapag masyadong mahina. Kapag may coronary artery disease ka naman, but you are taking your medications and other recommendations such as exercise and diet, you can actually live as long as your whole lifetime. Tama ba, Dr. Quaresma?
Mahirap sagutin yun, ano? Pero ganito na lang, ang sakit sa puso, hindi naman siya cancer, no? Na kung saan, pag may cancer ka, kumbaga basically wala nang gamot or minsan hindi na effective yung kumbaga may stage 4 na kumbaga oras na lang or panahon. Sa sakit sa puso, maraming options. Meron na kaming intervention. Hindi na po humahaba na po ang mga buhay ng mga tao may sakit sa puso. At paganda na ng paganda yung mga gamot namin, no? So hindi na siya tulad ng dati na pag may sakit ka sa puso, madali ka mamatay. Ngayon, magaganda na magamot as long as, again, your risk factors are controlled. And that is why yung importance ng aming lecture ngayon is preventive cardiology. Diba? So, before you develop complications of heart diseases, you have to control your risk factors. No? And you have to maintain the adequate number na kailangan nating i-control sa yung high blood, diabetes, cholesterol, etc., weight, etc. No? So, yung kaya mong kontrolin mo. No? Yung hindi natin kayang kontrolin, like yung, kung kailan tayo mamamatay, sa Diyos na po yun.
Yes, Doc. Amen. Opo. So maraming salamat po, Doc Joseph and Dr. Salcedo. Ano po? So sinabi nga natin doon that hindi naman ibig sabihin, sabi natin na kapag nagkaroon ng sakit sa puso na parang may ano ba, may bilang na ba, ano po, magbibilang natin yung buhay. Pero ang importante doon, may ginagawa, and at the same time po, sabi nga ni Doc Joseph, sisikapin natin na na iwasan na magkaroon ng sakit. Dumadami na po yung tanong natin, no, sa sunod-sunodin ko na lang, sabi dito, ano po ang mga early warning signs na mayroon na coronary artery disease at paano pa ito ma-diagnose po? Siguro the same din lang po dun sa tanong na dagdag ko dun na ano daw yung the best way, procedure para malaman na mayroong heart disease. Ayun po. Yes, Doctor.
Yung sa early warning signs na may nagbabara sa puso, pag nakakaramdam po kayo ng chest pain, so konting galaw lang, akyat kayo ng second floor, sumasakit na yung dibdib nyo, madali ka na yung hingalin, so pwede pong yan. So minsan yung sumasakit din ng tiyan, equivalent din yan ng angina or sakit sa puso, pero depende. So pag bumibigat ang dibdib, sumasakit ang dibdib on exertion na nare-relieve by rest, yan yung mga more on may bara sa puso na symptoms. Tapos, yung tanong nila kung anong best procedure para malaman kung may heart disease. Una, para ma-evaluate, i-check namin yung blood test niyo. Siyempre, kung may diabetes, mataas ang cholesterol, i-check yan. Tapos, ECG, i-check niyan kung merong sign na merong nagbabara sa puso or may previous heart attack, makikita yun sa ECG. Tapos kung may suspetsya kami na talagang may bara sa puso, nagpapa-2D echo kami o kaya yung stress test para mas ma-establish namin kung may strong probability na may bara talaga sa puso. Yun po.
Okay po. Thank you, Doc Jen. Sabi po dito, no, ano po ang management kapag cardiomegaly? Ayan, si Doc Joseph.
Maraming cause kasi ng cardiomegaly, no? But primarily, you have to, if in common cause ng cardiomegaly is yung hypertension. Okay, so you have to really control your blood pressure. May mga gamot na tayo that could stop or prevent remodeling, no, ng mga puso. But if you already have cardiomegaly, no, pag meron ka ng cardiomegaly by X-ray or by 2D echo or known ka na may sakit sa puso, meron ka na dapat maintenance at dapat tuloy-tuloy na yon. May mga bawal na rin pong iwasan, no, at mga bawal na rin pong gawin. So sumunod po tayo sa payo ng doktor para po makaiwas ng komplikasyon.
Thank you, Doc Joseph. Sabay ko na lang din dun sa sinabi na tungkol sa pag-inom ng gamot. Paano daw po yung herbal medicine? Ayan, pwede daw po ba siyang i-take at the same time dun sa mga prescribed na gamot ng related po sa puso, sakit sa puso? Ayan. Pwede daw po ba nating isabay yung herbal medicine at the same time po dun sa habang iniinom daw po yung mga gamot na related po sa sakit sa puso? Ayan. Sino po yung pwedeng sumagot?
Siguro depende sa kung anong herbal medicine. No? We have nothing against herbal medicine. Not all herbal medicine are useless or herbal. May mga herbal medicine naman na pwedeng makatulong. But we should not take the herbal medicine instead of the medicine. No? Kumbaga, these are add-on medicine only. No? We should first prioritize what is being prescribed. Secondly, may mga drug-to-drug interaction ang herbal medicine with your own prescribed medicine. So please consult your doctor pag may drug-to-drug interaction. Kasi, for example, a common medicine is a warfarin or Coumadin. Okay? This medicine has a lot of drug-to-drug interaction and most of the blood thinners. No? So you should really consult your doctor if you're trying a certain kind of herbal medicine for that matter. But again, hindi naman lahat ng herbal medicine ay useless or nakakasama. There are herbal medicine that are really therapeutic.
Okay, Doc. Thank you po. Ito, Doc, ang sabi do, ideal po ba siguro topic din related sa puso po. Sabi daw, ang Ideal po ba ang angioplasty for a 63-year-old male na may DM type 2? Ayan, considering the age. Ayan. Or is this a question ba na mukhang kailangan nating i-one-on-one, Doc Joseph? Pwede naman.
Ako na lang ba? Categorically, yes. No? Pag kayang-kaya ng angiographically, pwede siyang mabuksan by interventional percutaneous angioplasty, yes. No? But if you're dealing with severe three-vessel disease, sometimes with left main involvement, CABG yun or bypass. No? Pero generally, categorically, it depends upon the anatomy of the severity of the bara. Yes, pwede. At yung 60 years old, relatively young yun, bata yun. No? Mas marami pa kayong matatandang pasyente na ina-angioplasty at binabypass. So wag po kayong matakot sa mga ganitong procedures. In fact, ito na po yung mga procedures na nakaka-prolong ng buhay. So ito po yung mga procedures na sinasabi ko kanina na options na talagang would prolong your lifespan at hindi kayo mamamatay. So these are the newer procedures. Actually, not new, no? Hindi na to bago. And our experience in the Philippines, especially sa Philippine Heart Center, they're very much experienced, and I think we are at par with other countries in terms of our experience with these kinds of procedure.
Just to add, Dr. Joseph, no?
Yes, Doc.
Yung tanong kasi is 62-year-old female with CAD but diabetes, is PCI recommended? Yun, no? Generally speaking kasi, our stent right now, we have to know the benefits and risk ho. Generally, kapag ang pasyente ay malakas and can undergo coronary artery bypass graft, the longevity of the po kasi na ginagawa natin ng revascularized area, mas matagal pa rin with coronary artery bypass graft. However, sa mga diabetes kasi, patients kasi with the present stents right now na available for PCI, mas mabilis mag-deteriorate or nagka-clog yung PCI kapag may diabetic patients. But we do hope that in the future, makadevelop ng better stents to accommodate these diabetic patients para magkaroon ho ng better outcome in terms of stenting. Pero meron na po kami mga nagagawa na pasyente na diabetic na sinistent kasi these are patients who are naman high risk to undergo coronary artery bypass graft. But as long as you are mukhang okay naman ang outcome sa inyo, if you are somehow with good functional capacity, CABG is still better than PCI.
Ayun, thank you very much, Doc. Ayan, at saka po, if ever may dagdag na question, follow-up question po tungkol doon, pwede naman nating i-raise pa yan sa ating mga cardiologists po. Pero sagutin ko po siguro last two questions po, entertain natin last two questions. Sabi, ano daw po mas maganda para ma-evaluate ang bara sa puso? DP/DMI or angiogram? Yan. Si Doc Jen po. Sige po.
Good afternoon po. Yung sa dipyridamol or versus angiogram, kung nagsasuspect kasi ng bara sa puso, kung ayaw ng pasyente ng invasive, kasi ang gold standard talaga para makita mo is angiogram. Kasi sisilipin mo yung puso makikita mo talaga doon kung may bara, ilang percent yung bara. Yung kasing dipyridamol, para kasing nuclear tracer yan non-invasive siya, may lang na gamot, tapos mag-scan, makikita mo kung saan yung part ng puso na pwedeng may bara. Magla-light up doon yung mga possible na may bara. Pero hindi siya definitive na alam mo kung ilang percent yung bara. So, kung gold standard talaga, gusto mo makita kung talagang may barado at significant yung bara, angiogram talaga. Pero invasive kasi siya, kumpara dun sa dipyridamol.
Okay.
Yun po. Tapos yung isang tanong na gaano kataas ng LDL ang need ng maintenance, ang target talaga is less than 100 na LDL. Pero kung secondary prevention, yung may mga bara na sa puso, nag-stroke na, nag-heart attack na, less than 70 yung goal nila. So yun po.
Ayan. Thank you, Doc Jen. Doc Joseph, baka may nakita ka pa sa chat box na tingin niyo po pwede pang sagutin or
Actually,
si Doc
may nakita ko dito, sabi nila, as observed in our psych setting, na nakine-cater daw with both medical and psych problems, what if it is suggested to stop the psych meds but the patient is still unstable. First and foremost po, we do not advise to stop the psych meds. We have to do that kasi yun nga ang reason kung bakit sila nasa NCMH to stabilize. Kasi if we do not stabilize it end to end, they can have suicidal thoughts or inflict harm to others. So kailangan ho yan. What we do is, number one, kung yung mga psych meds na to will cause medical problems, for example, tachycardia, hypertension, or bradycardia, kung yun talaga ang what we usually do is we ask the psychiatrist kung yung meron bang alternatives. If the psychiatrist ang sinabi sa amin na there are no alternatives available, probably because of the market o walang available sa atin, and ang ginagawa po namin, we adjust the medical. Pero of course, I'm just talking about the cardiac medications. For example, the medication causes hypertension. We give antihypertensive medication. If the medication causes tachycardia, we start beta blockers. But the problem is, if the medication ho, katulad ho ng psych medication that causes hypotension na wala naman kaming binibigay ho na gamot, or bradycardia that can push the patient to ventricular fibrillation, mas deadly ho kasi pag nag-ventricular fibrillation, we would ask na baka merong other second line alternatives for that para hindi. Kasi ibig sabihin, wala kaming magagawa cardio-wise to improve that heart rate kasi mababa na. Wala naman tayo usually na first line recommendation sa pagpapabilis ng heart rate other than pacemaker. So yun lang ho ano. But we do not ask na i-discontinue in general.
Thank you po, Doc. How about Doc Joseph po? Kasi kung yes po.
Actually, this is a very good topic. No? I suggest nga, JM, no? I think our time is short for these kinds of topics. No? We should collaborate next time. Siguro, you should suggest topics, especially for our psych friends. Kenneth, nandiyan na si Kenneth. No? So, to separate siguro kasi this is a very large topic din, no? So at least nabuksan to, may mga cardiac medication actually can exacerbate psychiatric medicine and vice versa. So kailangan talaga we have to fine tune between the two. Secondly, I would like to take this opportunity to tell everyone that our PAB7 as a 2D echo machine, functional 2D echo machine. So yung mga pasyente natin na cardiac, no, meron na po tayong 2D echo sa PAB7 wherein you could request, no, to malasakit, no, so that we could maximize all of these non-invasive tests para for our own, no, for our employees and our patients. So yun lang.
Yes, Doc, thank you very much, Doc Joseph. And nga po, nasimulan natin to at hindi po ito magtatapos dito. With our limited time, talagang hindi lang po natin ma-entertain pa yung ibang mga questions. Pero yung mga question po na makikita namin sa chat box and dun sa ating FB Live, pwede nating ibato po later sa ating mga cardiologist po. And then gagawin natin, i-share natin dun sa Facebook Live din or pwede namin isend po sa inyo through email. How about Dr. Europa po? Ayan, any message pa po?
Sige, good afternoon, JM. Tama si Dr. Quaresma. It will be a very good collaboration regarding sa department nila sa amin. No? And it's a very good thing na meron na tayong cardiologist din dito. Pero regarding naman dun sa tanong kasi kung i-stop yung psych meds, most of our residents naman are trained not to stop the psych medications kasi they have a rotation of consultation in liaison kung saan yung mga drug-drug interaction ay dinidiscuss and they can even give the lowest possible dose of an antipsychotic for patients na may mga medical problem. And ang dictum pa rin naman kasi we are in a psychiatric hospital, kung behaviorally unstable yan, tapos may other medical condition, kung talagang nagwawala na, magulo na yan, then we give an antipsychotic, no? And it's maganda nga ngayon, may team effort kasi we have a cardiologist na rin na magre-refer tayo, tapos magkakaroon ng brainstorming between the two fields na ano ba yung mas maganda, ano yung dapat. So, very thankful ako na we have very competent cardiologists right now at the National Center for Mental Health and very good cardiologists yan sila Dr. Quaresma, Dr. Salcedo, and Dr. Oyek. first hand ko na experience yung mga input sila and they are very, very good. Thank
Yes, Doc. Thank you very much, Doc Europa. And again, thank you very much po sa ating mga speakers, sa ating mga cardiology, sa buong cardiology section. And now po to present lang a certificate of appreciation para sa ating mga speakers. Ayan, pwedeng pa-show po ng ating certificate. Again, yung mga question nyo po, no, i-relay po natin sa ating mga speakers po later and isa-send po namin ang inyong mga questions sa kanila. So hayaan niyo pong basahin ko muna itong ating certificate, the National Center for Mental Health Community Service Public Health Unit. Certificate of Appreciation is given to Dr. Alma Cristina Andin Salcedo, ayan, for generously extending unwavering time and effort as a resource speaker to the virtual Talakayan Kumustahang para sa puso ngayong may pandemya on February 23, 2021 via Zoom given this 23rd day of February 2021. Signed by yours truly, by Dr. Alden C. Cuyos, the OIC Chief of Medical Professional Staff 2 for the Community Service, and Dr. Noel V. Reyes, Medical Secretary Chief. So same po na mga certificates for Dr. Jeneline Oyek. Palakpakan po natin. Dr. And next po. And of course, Dr. Joseph Raymond Quaresma. Kanina po nakita natin yung certificate ni Dr. Kenneth Europa. Maraming salamat po. And now po, to formally close lang po yung ating program, ano po, may I call the Chief of NCMH General Hospital, Dr. Victor Gerardo Pondabella. Ayan, Doc Vic. Ayan, siguro pumapasok na si Doc. Ayan, so habang pumapasok lang si Doc, ano po, hinihintay lang natin, paalala lang po natin yung ating naiwan na question para sa makakatanggap pa ng 100 pesos na load. Ano ang relasyon ng coronary artery disease sa depression at ng depression sa coronary artery disease?
Hello, Jayan.
Yes, Doc.
Yes.
Doc Vic yan. Sa inyo po ang
Good afternoon. So, good afternoon to each and everyone. No? And at this point, I would like to congratulate not only the section of cardiology of the internal medicine, but most of all, I would like to congratulate all of us, all of us who participated in this afternoon's activity. Of course, with the theme na kamustahang para sa puso ngayong may pandemya, it cannot be overemphasized that in the midst of this pandemic, we, the healthcare workers, especially in government, we are the frontliners, but we are also human. We also get sick, so we're not invincible. So these activities, such as this, yung taking care of ourselves, and with this, with the celebration of Heart Month, we're talking about the heart. Hindi natin talaga maisa sa isang tabi na importante sa ating lahat ito. At maraming salamat sa lahat ng natin, mga katrabaho, sa ating mga kapwa empleyado, sa mga nag-participate ngayon. And rest assured, kung meron kayong mga katanungan, natural nandyan laman, nandito lang kami, Yan, especially kung ito tungkol sa puso, nariyan ng ating mga magagaling at magigiting na cardiologist, sila Dr. Quaresma, Dr. Salcedo, at saka si Dr. Oyek, Huwag kayong mag-aatubili kasi lalo na ngayon, we have a management who is fully supportive of really improving not only the psychiatric care for our patients, but also they are also focused on strengthening the general services support to our not only to our psychiatric patients, but also tayong mga empleyado ay nagbe-benefit, Hindi naman tayo hirap pa na para pupunta tayo sa, again, to other hospitals for our specialty needs. So, isa yan sa mga malaking ipagpapasalamat natin sa ating NCMH management that they are fully supportive of really strengthening the general services of NCMH. At wag po kayong mag-alala, kita naman natin ang somehow yung mga first wave of improvement in our facilities. At marami pang padating, marami pang services ang may o-offer ng ating general hospital, not only to our psychiatric inpatients but also to our employees. So sa hapong ito, sa lahat ng mga nag-participate at yung mga kaibigan nyo na maaaring makakakwentuhan nyo mamaya, ano man ang meron sa inyong puso, di ba? Pag-ibig man yan, taba man yan, kasawian, kabiguan, o batong puso yan, ari naway ang ending, malusog na puso ang meron tayo. So with that, again, let me congratulate each and everyone, our cardiology section, sa ating lahat na mga empleyado ng NCMH. Congratulations sa ating lahat at marami pa tayong mga activities na ganito, hindi lang yung para sa puso, kundi pati sa mga ibang organ systems, because the whole year, meron talagang mga sineselebrate na month for every year ang DOH. So maraming salamat sa inyo lahat. JM,
maraming salamat po.
And good afternoon.
Yes,
God
good
bless
afternoon.
us all.
Salamat po sa buong suporta ng ating NCMH General Hospital, ng Department of Internal Medicine at ng ating Cardiology Section. Again, di nga po ito natatapos kasi bukas po ang ating NCMH General Hospital para sa ating mga clients, at the same time para sa ating mga empleyado. So maraming salamat po. And one last request po for a photo opportunity. Lahat po ng pwedeng magbukas ng kanilang camera para sa ating photo opportunity. Nire-request lang po natin. And then I will be asking Ma'am Lichelle to do the screenshot or picture ng ating mga nasa Zoom. So siyempre hindi natin makasama yung nasa Facebook Live, pero maraming salamat po. Nakaabot po tayo ng more than 100 participants, employees. So ready okay na ba, Ma'am She? Sabihin mo lang pagtapos. So smile lang po kayo, no? Kasi hindi natin alam kung nasa ang page kayo ng Zoom meeting, ng Zoom room natin. But I will be waiting from Ma'am Shell kung okay na. Ayan, nakikita na rin sa Facebook Live yung ating mga participants.
Okay, so 3 batch po tayo. First batch po muna, say cheese. Wait lang po. Okay, isa pa po. Okay, next batch. Ito po, okay, loading pa po yung iba, and okay, okay po, wag po na kayo mag-post. Okay, sige, post na po, and 1, 2. Okay, so hinga po muna tayo. And para sa last batch po natin, wait lang po. Okay. So the last batch, yung iba po hindi nag-on ng camera. Okay, last batch. Okay, 1, please smile. Kahit nakamas. Okay, thank you so much po.
So, thank you, Ma'am Lichelle. And again, maraming salamat po. po-provide po namin dito sa chat box yung ating post-Talakayan evaluation para matanggap nyo po ang inyong mga certificate. And then, tawag lang po kayo sa local 298 para mabigyan po namin kayo ng advice kung paano nyo makukuha yung ating mga freebies. Again, maraming salamat po sa support na binigay ninyo at sa pag-participate sa ating activity. Alagaan po natin ang ating mga puso. Maraming salamat po. So habang, ayan, nakikita na pong ninyo ngayon sa ating chat box yung ating link at siguro habang nagsasagot sila, pwede nating iparinig yung ating pinaghandaang choreography. Pakita natin para sa ating kapag tumibok ang puso. Maraming salamat po. You may leave the Zoom room anytime. Maraming salamat po. Okay, so siguro in 1 minute po, i-close natin itong Zoom meeting natin. But again, ang importante po makuha nyo yung ating survey form, yung ating post-activity evaluation para matanggap nyo po ang inyong mga certificates. Hanggang sa susunod po na ating mga talakayan, kasama ang mga empleyado ng NCMH at mga clients natin, ano po, yung iba pa nating mga kliyente na naghihintay sa labas ng NCMH. I-close po natin ang ating Zoom meeting in 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Makukuha nyo pa rin po yung link. Oh, plus mahabol daw sa Sir Archie, yung link daw. Just click po the link and then kahit po i-close natin itong Zoom meeting, ma-access nyo po ang ating survey form. Maraming salamat po. Or if any question po, pwede po kayong tumawag sa amin sa mga 5 p.m. na sa office natin sa Public Health Unit Local 298. Or sorry, 289. Local 289. Thank you.